Sick of that. I think we're gonna have to take more of it.
And Barbara.
Yeah. Well, we're done.
Fine. You're fine. You know I don't mind.
Just tell me that March is supposed to be.
You're all set, Joe.
Okay. I'd like to call to order the St. Lawrence County Services Committee meeting of February 8th, 2021. I would entertain a motion to approve the agenda by Ms. Curran, seconded by Mr. Smithers. Any discussion? Seeing none, all in favor?
Aye.
Any opposed? Carried. I would entertain a motion to approve the minutes of the January 11th services meeting by Mr. Perkins, seconded by Mr. Smithers. Discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. We will have the COVID update with Dr. Williams first, please.
So I think Dana is actually going to pull up her slides first. Mine are part of her presentation.
All right, forgive me. Dana?
And I believe Dana is also going to be attempting to accept a state phone call here at 5:30 as well. So Dr. Williams, if she doesn't pop on here quickly, if you can go ahead, she's going to join us as soon as she's done.
Okay.
Go ahead, Doctor.
So I was just going to give a brief update about one specific aspect of the vaccination program. So some of you may have heard that the governor announced that there's going to be a new eligibility category for vaccination. And it's for people who have the following comorbid conditions are going to now qualify to be able to be vaccinated. So there are actually 13 different conditions. I'm going to go through them very quickly. But basically anyone who's had cancer, either currently or in remission, chronic kidney disease, pulmonary disease, which is fairly broadly defined, intellectual and developmental disabilities, including Down syndrome, heart conditions, which include heart failure, coronary artery disease, cardiomyopathies, but also just simple high blood pressure, immunocompromised states, severe obesity, pregnancy, sickle cell or thalassemia, which are blood conditions, type 1 or type 2 diabetes mellitus, cerebrovascular disease, neurologic conditions, and liver disease. So these are 13 categories of comorbid conditions. If people have these, they're now going to be eligible for vaccination beginning on February 15th. There is going to be a verification process, and I should note that all of this is new. And as with many things that come out of Albany, there's oftentimes some refinement after an announcement, but our understanding is that the verification process would include either a letter from a person's provider. The governor referred to medical information evidencing comorbidities. So I imagine this would be like a lot of primary care providers will print out a problem list, or people can go online and electronically get a copy of their problem list, which might include one of the diagnoses I just mentioned, or a signed attestation, which would be you would make an appointment based on your eligibility, and then you would sign an attestation form that verify that you had this condition. New York State did also talk about an audit process. So they're going to hold anyone who's doing the vaccinations accountable to having some sort of systematic way to confirm that people do have these conditions. As far as where to get vaccinated, if you're in one of these groups, the state site is going to be an option. So that's the state site that's at SUNY Potsdam or Maxey Hall. Starting on February 14th, so the day before, people are apparently going to be able to use the Am I Eligible online site or call the hotline. I believe the Am I Eligible site will be updated so that these conditions will be listed and people can verify that they have one of those conditions, and then they'll be given the option to schedule an appointment starting on February 15th. One of the tricky things is vaccine availability is going to be critical. And so I don't know that there's going to be appointments available at the state site on February 15th, but they're going to make every effort to do that. And then the second option is St. Lawrence County, the hospitals, and the providers' offices in the community are all going to cooperate and coordinate and set up vaccination clinics. This, again, will be very much dependent on vaccine availability. So again, this is an important development. I think if you look at who actually tends to suffer significant illness from COVID-19, it's people with these comorbid illnesses. So we in the medical profession are very happy to see this new category put out there. We're hoping that we're going to have enough vaccine to address this group. So that was all I was going to add tonight. Dana did have some other things to mention.
There you go. Say that again.
Dr. Williams, what kind of success are we have in immunizing those folks that are in the 1A and 1B category? How many vaccinations have we given compared to how many we've received?
So as a county, both through the state site, through the hospitals, through the clinics, and through the county, we've actually generally been very efficient at vaccinating people as soon as we receive the vaccine. The percentage fluctuates, but we've generally done as well or better than most counties at getting vaccines into arms.
Are we using all of the vaccine that is being delivered to us here in St. Lawrence County?
Yes, we are.
Okay, thank you. Mr. Arquette.
Thank you, Mr. Chairman. Just a comment, Dr. Williams, my mom's 79. She went Thursday for her first vaccine at SUNY Potsdam and could not have been more complimentary of the entire process from the time that she got there until she left. She was very professional, everybody was very kind and caring, and thank you very much for that.
That's great to hear. And I have to say that's been almost the universal observation that I've heard from people who've gone to that site. It's a great group of people working there. The people who are working there are really excited about what they do. I think the National Guard, everyone who's participating is doing a great job, but that's wonderful here.
Anyone else? I'd just like to echo that, Doctor. I went and had my first shot on Friday at St. Lawrence and run very efficiently, like a well-oiled machine, from the time I went in till the time I went out. And I can't say enough good about it. And the staffing level was amazing, in my estimation. Very well done, and I'm not looking forward to my second one, but I know it'll go as smoothly as the first one did. So thank you from all of us.
You're welcome.
Mr. Smithers has a question.
I'd just like to echo that also. I accompanied my wife to Maxey Hall here in Potsdam to get her first shot, and I was impressed with the efficiency and how well it was run. And I went home and signed up to get my shot. And the thought occurs to me that the more people that get vaccinated, obviously, the sooner the numbers are going to go down and we'll see things open up more. So I would encourage more and more people to not be afraid to get vaccinated.
Yeah. Okay, thank you. Anyone else? Well, thank you, Doctor. I don't know if Dr. McGuire has joined us yet.
It does
But
not
it doesn't
so.
appear so. She's tied up with the governor, obviously. So we will move right along to the presentation of the resolutions. And when Dr. McGuire, if she comes back or gets back, we'll put her right into action. So, Jay Ulrich, are you on?
I am. Good evening and thank you.
Good evening. To start off, we have a resolution authorizing the chair to sign a contract with St. Lawrence Health Systems for the tuberculosis program in the Public Health Department.
Next one down.
Yeah,
Next one down.
Choir.
yeah, we'll come back to Dana on the
Okay, we'll come
resolution
back
as
to that
well.
one.
That's okay.
All right. The next one is modifying the 2021 budget for community services for funding from the Office of Justice Programs. Moved by Ms. Curran, seconded by Mr. Perkins. Any discussion? We'll go to you, Jay.
Okay, so last month, a resolution passed that allowed for community services, namely the LGU actually, to embed this position rather than embedded in one of the sub-awardees. So in moving forward with that, we are in the middle of canvassing for that position. And we also now have this resolution, which is a budget for that position. So it includes salary and fringe, and then it also includes office supplies, a laptop, photocopying expenses, phone charges, postage, and automobile and fuel charges, totaling over a 3-year period, $275,607.
Any questions? Seeing none, all in favor?
Aye.
Oh, excuse me, Mr. Akers.
I'm just wondering if you can hear me. I was wondering what if Jay could talk about what these justice programs are.
This is the $900,000 COSUP grant that we got for the OTP. And 3 sub-awardees would be St. Lawrence Health Systems, Seaway Valley Prevention, and then the Grace House, the recovery house.
And thank you.
Anyone else? All in favor?
Aye.
Any opposed? Carried. The second resolution is authorizing the chair to sign a contract with Matthews Specialty Vehicles for a mobile treatment clinic. Moved by Ms. Curran. Is there a second? By Mr. Reagan and Mr. Smithers and Ms. Haggard. Any discussion? Jay, we'll give you that one also.
Okay. So we moved through the RFP selection process. We formed a committee and we went through the 4 responses for the RFP for the mobile vehicle for the mobile clinic. And we ended up choosing Matthews Specialty Vehicles. The 4 respondents were Don Brown Sales, Matthews Specialty Vehicles, Lifeline, and Faber Specialty. And some of them, well, most of them were over budget for one, and we asked to keep it down to either 26 to 28 feet. 2 of those were 33 feet, which is a little unwieldy, particularly for someone who's not used to driving a vehicle that big. Although it didn't require a CDL, we still thought that was a bit too large for our staff to handle. So so this one comes in at $173,829 before we actually see if we can negotiate the price down. For this endeavor, the clinic has a budget of $191,970, and we do not anticipate having to modify the budget. There's approximately $28,000 left of the SOAR grant monies that's going to be used for computers, telehealth equipment. We got snow tires, roadside assistance, things like that. So just so give you a little kind of insight into, you know, this proposed purchase. This vehicle is 25 feet in length. It's a Ford F-450. It has a gasoline engine, 7,000 watt generator, LED lighting, interior graphics wrap or exterior graphics wrap. That actually we took off the purchase price because we're getting monies through public health for their opioid response program, the partners, the coalition that they have. It's ADA compliant, American Disabilities Act compliant. It's going to have a freshwater holding tank. It's going to have an under chassis hydraulic wheelchair lift. In terms of the space, it's going to have a confidential exam room, including a desk and a workspace with storage area. It's going to have a reception / confidential client intake / counseling room, including desk, workspace with storage areas, seating for 2, wiring for a refrigerator. It's going to have a sink with hot and cold running water, be a space for digital sail and height measuring. It's going to have a lab area and a counter workspace with sink, hot water, cold water running. It's going to have a lavatory. It's going to have an LP gas heater. There's going to be 2 small locking. There's going to be a small safe for locking and a locking cabinet for records. It's also going to have a power awning for the summertime. And then there'll be 2 refrigerators to store medications as needed. So it's going to be pretty much a self-contained unit. We're pretty excited about the opportunity to get this. I don't know, are there any questions about it or?
Mr. Reagan.
Jay, could you explain to us how it's going to be used?
Yes. So in terms of the timeline, I mean, the first thing would be to sign the purchase agreement or the contract. And then we will be putting 50% of the down payment, paying 50%. And it's going to take approximately 6 months or possibly even more to build this. So there's going to be a lag from the time the contract's signed till we actually get the vehicle and put it into use. So, you know, and during that time, we plan to do some strategic planning with a work group, you know, to figure out the logistics and the scheduling and the disbursement of the vehicle. But in terms of its use case, I mean, obviously we're going to be doing counseling. We're going to be doing peer services out of it. It's going to be equipped with telehealth equipment for medicated assisted treatment. We're also can do mental health treatment out of the van, whether that be in person or through telemedicine or telehealth. You know, we've had discussions with public health for them to provide immunizations for communicable diseases. I think, you know, given the situation with COVID right now, that is on hold, but that is something that, you know, we've had discussions about as a use. Also for Narcan, the opioid prevention program, overdose prevention program, we'll be using it for that purpose. Toxicology testing, health assessments, and of course community education and, you know, taking it to certain events. And then lastly, we can also do primary care out there. So it's going to be a multi-use clinic, mobile clinic.
Mr. Akers.
Thank you. Jay, so what medically assisted treatments will be actually taking place out of this van, and then what type of security will be needed?
the MAT that we're dispensing right now is Suboxone, which is prescription. So we do not hold those medications on site. We do also give Vivitrol, which is an injection every 30 days for either alcohol or opioid use. We do receive those medications. They do need to be refrigerated. So those would be the only ones that would be physically probably on site. In prescribing mental health medications, those would also be done through a prescription to the pharmacy. So the Vivitrol, is not a narcotic medication. It's not something that somebody can use and feed their addiction with. It's not that type of medication.
So with the Vivitrol, I think at one point in time, I thought we only had about a dozen on that anyway. Is that correct? Because
correct. Yeah,
with the Vivitrol, you can't get high. So nobody wants to take it because they still want to get high. I do know a couple people that are alcoholics that are on it, and it's working quite well for them. So primarily, it seems like the van will actually be getting out there from a public presence, and actually for mental and substance abuse counseling, for on the road for people who don't have transportation. Is that kind of the idea of it?
Yes.
Mr. Burke.
Thank you, Jay.
Jay, I was just wondering, maybe could you tell us how this came about? I think it's a wonderful service for a county as large as ours, and I think it would be helpful knowing how this evolved.
Well, prior to there being SOAR monies available, which is the state opioid response money that was dispersed to the various counties, there was what they call COTI monies. And part of the COTI initiative was for providers to develop mobile clinics in their community. And those were selected by the state. So I know over in Watertown, Credo was selected as a COTI provider, but we were not. There was no one in St. Lawrence County that was selected. So then SOAR monies came following the COTI funding, and this was a competitive RFP process that we responded and submitted an application to the state, and we were awarded the $225,000 for this vehicle.
You and your team that pursued that deserve a lot of credit, Jay.
Thank you.
Mr. Manelli.
Thank you, Mr. Chairman. Jay, I'm just wondering, recently we've kind of highlighted broadband and connectivity and low or no connectivity areas within our county with the reliance on the electronic health record and the telehealth that you mentioned. Do you see connectivity across the county being an issue to provide those services in a mobile treatment clinic? Are you going to be limited to certain areas? Will there be certain areas of the county where you are not able to serve?
Well, I haven't fully researched that, but we are probably going to go into some of the more remote outlying communities, rather than going specifically way into the mountains, so to speak, where there may not be connectivity. So I would think in the villages that we're going to be utilizing this vehicle, that we should have some availability for internet.
Go ahead.
So just to follow up then, so will there be, will you be using like Wi-Fi, or would it be a secure internet? Will there be contracts that have to be signed with certain areas to access internet? I think Shana might know.
Go Go ahead.
I can jump in on that, Jay. So Rick has been working with the city buses or like our public transportation, and they have like a Wi-Fi access on those buses. And so it would be very similar to that. And as Jay said, when we go into a village, we wouldn't be like on the side of the road somewhere where we provide service. We'd go into a village and maybe be at a library or a Kinney's. So many of those places would have Wi-Fi connectivity. However, we will have our own portable Wi-Fi, just like our county buses, public transportation have. And our electronic health record is web-based as well. And it doesn't, it's completely secure in a cloud web-based. So we don't have to do anything special for security reasons or the, for the electronic health record. Same with the telepractice. Rick doesn't anticipate there's going to be problems with connectivity with the system we're looking at. So he has kind of really looked into that quite well.
Great. Thank you very much, both of you.
Anyone else have any questions? Mr. Perkins.
Jay, this vehicle, it's pretty advanced. What type of warranty will come with this? There's some pretty specialized equipment in it.
So the air conditioner is 2 years. Corrosion, including frame rail, is 5 years. The engine is 5 years or 50,000 miles. Emissions is 5 years or 50,000 miles. The generator is 1,000 hours. The noise emissions is the life of the vehicle. The suspension is 2 years. And the powertrain with extended warranty is 5 years or 100,000 miles.
Thank you.
Okay. Anyone who hasn't spoken yet, wish to speak? Mr. Akers? No response from Mr. Akers. Is there anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the renaming of Community Services Chemical Dependency Clinics to St. Lawrence County Addiction Services. Moved by Mr. Denisha, seconded by Mr. Smithers. Any discussion? Seeing none, all in favor?
Aye.
Opposed?
May I?
I think Dave has his hand up, I think.
Who did? Dave Forsythe?
Yes, I did.
Hey.
Just a couple questions. So Jay, it's for the stereotyping that we're basically rebranding, right? That's the purpose of this resolution.
Yeah, we're trying to prevent stigma. I mean, it's very out. You know, we're kind of outdated in our nomenclature for the clinics.
But do you feel that community service chemical dependency is less than county addiction services as far as the stereotype?
Well, I mean, that comes from Oasis. I mean, they are changing their wording across the board. Yes. So,
Okay, so there's other counties that are going into this branding.
and it's not.
What about cost associated with it? Because licensing and all that, will that have to come into play? And mailings?
We have to get approval from Oasis for this, and we've talked to them, and they're on board with it as well. We weren't going to just jump in and get our stationery all reprinted. We were probably just going to let it, change over by attrition.
Yep.
Rather than throw, perfectly good stationery away, and letterheads and things like that. Along with the renaming, we also created a logo. If you'd like, I could share my screen and show you the new logo.
Sure, I wouldn't mind seeing it. I don't know about everyone else, but yeah, it'd be great.
We'd be happy to look at it, Jay.
Can everyone see that?
Yeah, okay.
Okay. Thank you very much.
All right, I'm all
Thanks.
set.
Okay. Anyone else? We'll get back so I can see any hands that might be up.
Well, I'm trying to get out. Oh. There we go.
All right. Anyone else wish to speak to the resolution? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is a resolution authorizing the chair to sign a contract with 1011 Group for behavioral health, electronic health records, and billing software. Motion by Mr. Perkins, seconded by Mr. Smithers and Ms. Curran. Any discussion? Go ahead, Jay.
All right, so not unlike the RFP process that we went through for the mobile vehicle, we also went through a similar process in the selection of a new electronic health record for the department. So we had a committee. We had John Burke was on the committee, Rick Johnson, David Thompson from IT, program directors, our senior KSAC counselor, and our fiscal staff. So, you know, we had demonstrations from 3 vendors, those being Acumatic, NetSmart, and 1011. And after we had those demonstrations, there was some subsequent question and answers, and we did, some price comparisons, some 60-month price comparisons, and we had a unanimous decision to go with 1011. So in terms of cost, this is what was quoted to us. It's not necessarily what the bottom line is going to be after we, finish our negotiations. But it's, it's a very similar cost to what we're paying now, which is we're paying IMA, which is $88,696 a year. This cost is about $1,200 more, $89,832 a year. So, and we feel it's going to be a much well-suited product for our needs. So, this, the 1011 is used by 13 other DCSs who run county clinics. Rick Johnson reached out to 5 of those IT managers for those counties, and they all gave 1011 excellent reviews in terms of not only reasonable cost, but also its functionality, and for the support that they give during the transition or the installation process, the startup process, but also the ongoing support. In terms of Acumatic, that was a very similar to kind of what we're using now in terms of size of the organization. NetSmart was a much bigger company. And we felt that software product was geared towards much larger operations, quite expensive. That would have been $176,970 a year, which is almost twice what we'd be paying for 1011. So, cost wasn't the only factor in this. But certainly, did have an influence. But the 1011 was, very inclusive in terms of what they would give us as a package. NetSmart was more of what I would call a tabula rasa. It just, it was kind of a shell, and you had to build it. And the onboarding process, the startup process, would have been twice as long for that very reason. And we didn't feel that we just needed that sophisticated of a system. 1011 is a word-based system, so we can always export into Excel. to create, any tables or graphs that we want to demonstrate, our data for. NetSmart was not planning to come on site during the installation period. They were going to do it all remotely, whereas 1011, they will be sending a consultant for 5 days to help implement the initial software package product. We like that. They didn't have a lot of hidden costs. NetSmart had a 3 to 5% increase per year. And we're locked into this if we go this route for 5 years with no increase. So, a lot of the things that we're using would more easily integrate with the 1011. So, for instance, our Intrado patient message and call service, they have a way to interface with that. NetSmart did not. We will continue to use, our instant message system. We didn't see a significant difference in their billing platform for the amount that NetSmart was asking for their software package. So we felt that the 1011 had a very adequate, built-in billing system. There would be things that would be batches that could be created in the background, much like NetSmart. They had an easy flow from the referral to the pre-admission process into the programs. We can create our own forms. We don't have to ask them to create our forms and then be charged for those new forms. There was just a lot of things. The iStop, which is looking to make sure that people aren't medication shopping, meaning getting, it's a state program, it's a prescription monitoring program that was directly accessible through this software package, so that we can tell if people are getting, say, controlled substances from one or more providers. They had a built-in eligibility check for insurances. We can link both our Rio, which is Healthy Connections, and Psyches. Psyches is a state database. So that's, we can interface with those portals. So we just felt, not only because, I think there's a reason why there's no counties that use NetSmart. I just think it was too expensive for county-run clinics. And I think it was, just kind of an overkill in terms of what we need, for the size of our operations. So the fact that 13 counties are using it and seem to be fairly happy with it and are recommending it, we felt that was a good fit for our county as well.
Thank you, Jay. Anyone else have any questions or discussion? Mr. Perkins.
Jay, this is replacing IMA billing?
What we're going to do is we are going to see how this onboarding process and support process goes. And we're hoping that with this new software and hopefully the new ease of billing, that we'll be able to bill internally and not have to hire this software company or some other company to do our billing for us. If we find that that is not practical, then we have to circle back around. But the plan right now is we are going to hopefully, we're all going to be on ground zero learning this new software program. And hopefully we'll have our third account clerk hired fairly soon. So we'll have 3 account clerks that will be on ground level, plus our administrative services managers, which is going to be overseeing that billing project. So we're hoping for a smooth transition in our billing as well and taking it back.
So on the billing and the paid percentages, what do you expect with that in the transition? Is it going to be comparable? Are we going to be still getting paid in the 90% range?
I'm hoping, yes. Because we're going to be running, we're going to be running 2 EHR software platforms concurrently. So we won't be switching over to the billing until we're pretty confident that we're familiar with, all the nuances of how to do the billing before we switch to our billing through this new platform.
Thank you.
Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is a resolution authorizing the chair to sign a contract with Seaway Valley Prevention Council for coordinated peer services. Moved by Ms. Curran, seconded by Mr. Smithers. Any discussion? Go ahead, Jay.
So Oasis released an RFP for what they call regional SOAR projects. And they asked that there at least be 5 counties involved in a regional approach to enhancing access to treatment and care for opioid and stimulant use disorder. So we got together, kind of, I guess you'd call like a consortium. There were 6 counties involved that included St. Lawrence County, Lewis County, Jefferson County, Franklin County, Essex County, and Clinton County. And as part of our part in that whole regional approach would be to have Seaway Valley hire a CERPA, Certified Recovery Peer Advocate, and embed that peer advocate into our county addictions clinics. And so it would be a contract between us and Seaway Valley Prevention. They would get SOAR monies till September 30th of this year for this position. And so the salary and fringe that will be handled and overseen by Seaway Valley will be paid for by the grant, by the SOAR money, but we will also be able to bill for these services without having, any salary and fringe cost. And it will also increase our units of service, which is what our state aid, one of the things our state aid is based on. So it'll be helpful in that situation as well. So after the money runs out, it's kind of a little bit of a pilot project for Seaway Valley. They, would have to ascertain if they wanted to continue to keep this peer on board, and we would have to ascertain, what kind of arrangements, financial arrangements we would come to if we were then going to continue or extend this contract past the SOAR deadline, which is the end of September.
Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. And Jay, you are going to provide us with an update on the clinics.
Yep. So, there's not a lot of significant change. Our no-show rate seems to ebb and flow between 11 and 13% in any given month. So a little bit of a variance, but I think that's not a bad percentage compared to what it used to be and compared to some of the other programs in the surrounding area. Clinic counselor visit average, again, it's about the same. It went down a little from last month, but pretty much the same. Chemical dependency visits for 7 hours, it went up just a little bit, although the weighted visits actually went down in chemical dependency from 70.6 last month of weighted visits, and it was 70.2 this month. So it went down a little bit. And again, the goal is 72% for that. So we have not met the goal on the chemical dependency side, whereas on the mental health side, their weighted face-to-face continues to climb, which is at 80.7% face-to-face billable hours of time spent either in the office or when they're working from home. So there was no significant change in the prescriber visits. The average is about 10 visits a day for those 3 prescribers. In terms of waiting list, the updated numbers for that is for the addiction services. We now have 15 on the waiting list. And for the mental health clinic, we now have about 55, but there was also 8 individuals that were assigned prescriber for medication, but we'd also like them to get counseling and therapy. So that would bring it a total to 63 on the waiting list. We've offered, and a counselor has accepted a position to become a mental health counselor.
Every time we come to Kitty's, it's all about the candy on it. You think she was 5 years old?
I apologize, Mr. Chairman.
This counselor is duly licensed, meaning they have a CASAC as well as they're a licensed mental health counselor. So that's also a plus. So we're looking forward to bringing her on board. This person is going to be starting the 22nd of February. In terms of the services provided, the numbers did dip down a little bit. Previous month was 737 in terms of the individuals served, and in November it was 696. I think part of that was probably due to the holidays and vacation times, but we'll see in moving forward if we can continue to trend upward with that. And then lastly, the billing percentages, we're hitting the mark there with 90% paid of what was billed.
Any questions or comments? Mr. Burke?
Jay, I see that on our wait list, Governor Messina and Ogdensburg have 0. Has that number been a sustained number?
Well, see, we really don't, because we're using virtual services, we really don't differentiate. So, because we could have a counselor who's sitting in Canton do an initial assessment on somebody that lives in Ogdensburg because we're doing it virtually. So we're really not separating it out. I mean, I'm not sure why there's a 12 there in Canton, because that encompasses the entire county. And I don't have the breakdown in terms of where these individuals actually reside, but for all practical purposes, any of our counselors can see any of the recipients in any town or village.
The reason I asked, Jay, is I guess I'm just wondering, if that's kind of a sustained number, it would appear that the substance abuse treatment is meeting the needs for at least the majority of the geographic area. Would that be an accurate conclusion?
Well, I mean, I think there's still a lot of individuals out there that are in need of treatment that aren't reaching out to get treatment for whatever reason. I think, again, with the courts, not being, kind of going back to prioritizing and being remote, that has had an impact on our referral base as well. So, I mean, I think there's still underserved. I think there's that are being underserved out there.
Thank you, Jay.
Anyone else? Seeing that, Jay, thank you very much. Great presentation.
All right, thank you.
We're going to move to Dana McGuire and get her report if she is with us at this time. And she is. Dana, go right ahead.
So do you want my COVID report or would you like my resolution?
Let's go with the resolution to start with.
Okay.
And that resolution is authorizing the chair to sign a contract with the St. Lawrence Health Systems for the tuberculosis program in the Public Health Department. Moved by Mr. Perkins, seconded by Mr. Smithers and Ms. Curran. Go ahead, Dana.
So this resolution is for TB services for when we have patients, and we'd like the contract to be with St. Lawrence Health Systems. This contract period would go for 3 years, and how it would work is that the hospital would bill for the services that they do, and then just any of the cost that is not picked up by the person's health insurance would be covered by our office. This is different than what we've done in the past, as we normally have an annual contract with a doctor that does these kind of services. But now we would be moving over to be working with a hospital system. We would use their kind of providers in the services that we need. They would bill insurance, and then we would pick up just things that aren't going to be covered by the insurance.
Any questions of Dr. McGuire or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. Now, Dana, if you want to give us a report on COVID, we'd love to hear it.
Okay, so let me share my screen, just 1 second. Okay. So this is just an update of what we have on the cases and then what we've been doing towards the vaccinations as well. So currently we have 5,177 cases to date, and that's since we started the response back in March. We have 31 people who are currently in the hospital. Of the cases we have, 475 of them are actively in isolation. 4,629 have been through that process. We have 73 deaths since March. And next, I just put this New York State tracker up here because I haven't shown it in a while. But here it shows that we have 4,700 cases, where I've just mentioned we have 5,177 cases. So this is just to keep in mind that we are off count with the state, and that is because some of the testing centers and ways you can be tested still do not get reported into the state system. So it's just important to keep this in mind when we talk about the positivity rates and what's going on here just in the county. And so currently we're off about 465 cases based on what the state says that we have going on. Here is that kind of a daily shot of what we have on a case-by-case basis. So you can see that the trend kind of overall does look like it's decreasing. For the, you can see the 4 weeks that I talked about last week, that they're really high, where we had just almost 600 cases each week. And during the last 2 weeks, we are kind of downward. So we now have almost 2 weeks worth of this data that does show that we're kind of coming down, although that last week there's still 1 day left for the reporting. So far this week we have 273 cases. And then I like to show that on a daily basis, because really when you look at the case investigations and contact tracing that needs to be done, that's what we see on a daily basis, what has to be like assigned out. And so you can see that we are just coming down. When I looked at the average for the 6-day period we have, so there's still that 1 day left, we are at just 46 cases per day, where last week we were at about 56, and that's as compared to about 85 for those 4 weeks that did kind of follow the holidays. I just wanted to look at last month because this really was the highest month that we've seen during the whole time that we've been in the response. And when we were in January, the average daily case rate that we had was about like 77 cases per day. And so currently we're at like 56 per day when you take the average of the last full week that we've had. So we have seen so far a pretty steep drop. I'm hoping that that's not just a blip and that we'll continue to see that. But we'll just have to see as time goes. With that said, showing the decreases in the cases we've seen, I wanted to put up the hospitalizations. So I showed this last week as well, and you can see that in November, we were just over 10 per day, and in the December time, we were just over 17 per day. And while we're seeing this decrease now as this month has started, we've stayed stable at about 30 cases on a daily average. So there's still quite a few people who are still quite ill, and we still have quite a few of the hospitalizations. Keep in mind, too, that when we do report hospitalizations for the county, those are the hospitalizations of those people who are the current cases in our county. So that could mean that they're hospitalized here in our county or just in another county because they needed more care. I am not aware that we've had any transfers due to a capacity issue. Some people have needed just a higher level of care that they could receive here in St. Lawrence County. And again, there are some spaces where there are no data, and that's because it was a weekend or just a holiday. Don't have that marked. I've started to look at why we might be seeing this decrease, if it's truly a decrease, or what might be going on. So here is the tracker that you see on the state website for how much testing is done in the last week. And so you can see that we're staying at about 600 to 700 cases tests per day, and we had one strong day of that testing. What the state site does not show anymore is testing in the last 30 days, so it's hard for me to get a comparison. They show the last of the week, and they go back kind of since the testing has kind of started. So it's hard for me to see what's been going on. So I'm going to track this just on a weekly basis so I can see if one of the reasons what we might see less cases is because we've seen a decrease with the testing. But that I'm not sure of yet. And it might be due to
she's still
we have
there.
finally gotten.
And that's the way I asked. So unless there's an objection, is that okay with you?
Sounds good.
We might be seeing this decrease too because we have now finally gotten through those holiday periods and then all of those cases and kind of that cycle that kind of happens after that. So more time is kind of needed to see why we might see that decrease. Here is the pie chart that shows how many people are in isolation and quarantine right now. So for isolation, which this number at 541 includes both the hospitalizations and those who are in isolation, and this was of this morning. So some of the numbers that I've already reported this evening were of just later in the day, and our tracking sheet changes constantly as cases come in and as people do get released from isolation or quarantine. That 1,000 number is the amount of folks who are in the mandatory quarantine, and those are the people who have been exposed to someone who has tested positive. So those who have been through the process have been closed out have been just over 22,000. So that is for both the isolation and or the quarantine process. I know I mentioned this slide last week too. This is really important. So we have really moved to a virtual team for case investigation and contact tracing. So the phone numbers that people see when they're going to be called, if they're going to be identified as a case or someone who is going to need to quarantine, it's really important just to answer the phone. So that's the best message that we can get out, just so that we can have this process go as fast as kind of possible. Right now, we are getting to cases within about 24 to 48 hours. So like I mentioned last week, I know we had kind of a lag time that we were seeing, but because we have just all of this extra help, we have really been able to increase or decrease that time that it takes just to get to people. I just want to switch a little bit into the vaccination process, and I wanted to just review the providers and who can be providing vaccines to who. So hospitals are still right now supposed to focus on the 1A populations, and that is to healthcare providers and the staff that they have. Pharmacies have been given vaccine to do the 65 plus group. We as the local health department in the first few weeks started out with the public safety, with the teachers, with transit, courts. We're focusing this week on the grocery store workers. We've seen a little bit of the 65 and plus and those who live and work in a group home. We are able to start this week with restaurant workers, with the drivers and the for-hire drivers. And then we'll talk about just in a minute that we can expand that 1B group to those with an underlying health condition. The state sites are still able to do all of these populations. So to really talk about the vaccine distribution from pods here in the county, which are the points of the distribution, SUNY Potsdam was doing about 500 per day, and this week they started on the second doses of those folks that got their first dose with them. So now they're functioning at about 1,000 per day. We as the local health department, this is the 4th week that we have received vaccine from the state. So on the first week, we did 209 people, and that was at the county jail. In the second week, we moved to St. Lawrence University in the field house, and we were able to do 217. And of those both first 2 weeks were of the 1B population, mainly transit workers, teachers, and public safety and courts. Last week, we were again at St. Lawrence University, and we saw 371 people. We did 219 of the 1B group. We did 109 of the 65 and up group, and we did 43 individuals being staff and the residents of group homes. And that's because we got 200 just extra doses that were allocated to us, 100 to specifically be used for the 65 up group, and 100 to be used over 3 weeks to the group that comes from the group homes. This week, we were allocated 300 doses, which is 100 extra doses than we expected. And the focus here again is to be on the group home folks and also restaurants and the drivers. We also are able to use our vaccine for the 65 and up group as well. We will have a mix of people that we will be vaccinating. This week, we will be doing our pod at the Dome in Ogdensburg, so we are trying to move around. We have gotten great support from all of the locations we've used, being the county jail, St. Lawrence, and now we did a site visit just today to the Dome to plan how we are going to set up that pod site. We have used about 15 to 40 volunteers for each of the times that we've kind of set up a pod, and so we have gotten great support from the community, being non-medical and the medical kind of providers. We've gotten assistance from all of the hospital systems. The university has been great in the last 2 weeks there. Jail staff just really helped us out, and we have many of the county departments who are assisting us. We also have help to manage the staffing of all the volunteers that we have through the IDA. And so it's really just a large kind of like a community project that we're all kind of working on. And so far, we've gotten very good feedback from the pods that we've held. This upcoming week, starting on the 15th, we are going to be able to do vaccinations of those with some other types of the health conditions. We're still learning what that means. We did have a call with the state, and there is going to be signups for the state site starting on, I think, Monday. We're going to know what the local health department's allocation for this group is going to be by the end of the week. And we're working on what kind of verification will have to be put in place as we see what kind of diagnoses, will be accepted. And that's where I think Dr. Williams will do some of the next kind of information. Dr. Williams?
Dana, he's already given us that report at the start of the meeting. If you want to give it again and go over it, that's up to you.
Nope, it's just going to be a list of those diagnoses, and so we'll just need to work on how we're going to do verification of that, so we have proof of who is going to be eligible. The last thing I always like to remind people is, we do have vaccine here. We're hopeful that we're kind of seeing the light, but we do have to follow all of the guidance with mask wearing, with social distancing, with hand hygiene, and that's, whether you do get vaccinated or not, and to keep in mind that the guidance for isolation and the quarantine process has not yet changed just because you might be vaccinated. So we're still learning more and more about the vaccines, so until we get new guidance, it's important just to follow these recommendations and to continue to isolate or to quarantine if you are exposed. And that's all I have for this evening.
Okay, thank you. We got a couple of questions. The first one from Mr. Denisha.
Dr. McGuire, hypothetical question. School teacher, they get a vaccination, and they have, of course, they have their second vaccination scheduled. During the course of, after they have received their initial vaccination, they're exposed to someone that has COVID. So they go into isolation, they exhibit no symptoms at all. The day that they're supposed to be released from quarantine would be, say, tonight. Typically it's, I believe it's 11:55 or midnight, but their second vaccination shot was due at appointment to have a vaccination today at 6.
So are you asking what you do if you're supposed to go to your second dose?
Absolutely.
Yeah. So state guidance says that you are supposed to remain in the quarantine process. So if that was to happen, we would need to work with that individual to see when we could get them to get their second dose. We know that you have 42 days from the first dose to get the second dose. So we would try to work it just in that schedule. Now I know that is different from the state site that we have here, and local health departments are just hearing this just across the state as well. But I'm not sure that all of our pod sites we would be able to always run outside with the staffing that we have and things. And state guidance right now is to wait while you're in the quarantine process.
Okay, thank you.
Ms. Curran.
Thank you, Mr. Chairman. Do we have a number of people who have been vaccinated, Dana, both like between the state and the county and Kinney's? Do we have a number for that?
Yeah, so we have to pull a report. It used to be twice a week for the hub because they're doing that dashboard. and they changed it so we're not doing it twice a week anymore. We're doing it once a week. So we just provided our whole large spreadsheet. They should have a new dashboard out, like in the morning. If that comes out, I will send that to everyone. We don't have an update from where I gave it from last Monday, but I can try to pull our Excel sheet and do some sorting and see from the pharmacy point of view, from the hospital point of view. But the way we take the report from NICES, which is that it's kind of like the holding tank for all vaccines that we all get, we can only run so many at a time, so we have to do it on a weekly basis. I have to merge those and try to get that information, but I'll try to get that out.
Do you remember what it happened to be? Sorry, do you remember what it happened to be the last time you ran it?
We ran our county report this morning. It's not one kind of easy document to read. So I was waiting for the dashboard just to come out because they put that all out.
Thank you.
Anyone else? Mr. Fay?
I'd just like to highlight something that's sad, but it's part of the North Country News, I think. On public PBS TV Friday night, they highlighted 5 people that had died of COVID-19. And one of them highlighted was Stephen Prince, was the editor of the South Bend Tribune in South Bend, Indiana. That's close to home in Notre Dame. And he was the editor of the paper. And he graduated from Messina High School a year behind me. I was on an athletic team from him, and they highlighted his father as an editor of paper and his grandmother. His father was Leonard Prince, the editor of the Messina Observer when I was a kid, and I was a newspaper boy for that paper. Steve was a great guy. Anybody wants to go on and look up his name under South Bend, they get a great tribute for him. And actually, you can go to public broadcasting system for Friday nights for memorandums, and he is listed as the 3rd person out of the 5 people they highlight. It's a great tribute to him. He was a great guy. Just thought we should know that. I'd like to pass the word on anyways. Thank you.
Thank you for that, Mr. Fay. Mr. Forsythe?
Thank you, Mr. Chair. Dr. McGuire, nursing home, I know it's vaccination, but are the nursing homes still testing employees?
I believe it's still a requirement to test on a weekly basis, yes.
Okay, all right. That's all I need. Thank you.
Anyone else? Seeing none, thank you very much, Dana.
Thank you.
All right. And listen, folks, unless there's an objection, what I would like to do is to move Legislator Akers' resolution next so that it'll improve the flow a little bit between Cindy Ackerman's presentation and the vacancy committee decision. So unless I hear an objection, I would like to offer that resolution. And I don't see one. So Legislator Akers has a resolution appealing to Section 10 and St. Lawrence County School Districts to let them play. Moved by Ms. Haggard and seconded by Mr. Fay, Reagan, Perkins, Curran, Smithers, Sheridan. I hope I got it. And Mr. Arquette. And Ms. Haggard.
Yes, Mr. Chairman, I jumped the gun. I wanted to get right in on the discussion. I do not want to be listed as moved.
Okay. So it's moved and seconded. Discussion. Mr. Akers.
Thank you, Mr. Chairman. I think we had a great presentation by the students that belong to the various schools before us last Monday. It was actually very moving. And, all along we've been told to follow the science. And so what's been happening is we follow the science when the science fits our view. We know that 70% of the transfer is actually in families itself. We know that mortalities for children that are in elementary school and high school are very low, that the incidence of transmission is extremely low. There's been no measurement whatsoever about the mental state of the youth here in St. Lawrence County as to how they're feeling, their isolation, their lack of social involvement with their peers, just in general, this whole feeling of isolation. There's been 35 counties that have, in New York State, that have moved ahead. It was an executive order deemed by Governor Cuomo that it was safe to have these sports. And there's been several states outside of New York State that are letting interscholastic sports happen. And I think that I would like to support the students, and that's why we have come forth with this resolution.
Thank you.
Thank you.
Mr. Arquette?
Thank you, Mr. Chairman. You know, I think at the onset of this pandemic, which I should be noted, I have full respect for the trauma that this thing brings with it. But I think at the onset, there was a lot of economics versus the health, loss for folks such as businesses and people in general. And some viewed the economic worse than the health and vice versa. But I don't think that the mental health portion of it, came into play, and especially where our youth are concerned. Now that we've been this long into it, for me anyway, that has become a major concern, the mental health portion. And I agree with Mr. Akers in the fact that, a lot of the youth, and certainly with full respect for the youth that have suffered from the disease, but a lot of the youth are asymptomatic. I think that if, a plant, we're not talking about filling every hockey arena in the area full of spectators. We're talking about, having the kids get out there in a safe fashion, playing the sports that could bring some mental relief to many of them. With that being said, I'll be supporting the resolution, and I ask to be a co-sponsor.
Ms. Hager?
I'm sorry, did you call on me?
Yes, I did.
Thank you, Mr. Chairman. I love getting my agenda every week because there's always something that's exciting, and this one baffles me. And I will tell you why. First of all, I want to say that I am peripherally involved in a school district that has its own board, its own superintendent, its own everything. They're autonomous in a sense. We're a board. We don't tell them what to do, nor do we tell BOCES what to do. That being said, I'm stuck. I'm a Grinch if I don't vote for it because I'm a hockey mom, retired hockey mom. Let me put it that way. My daughter was in swimming. All these sports that we're talking about, I've been firsthand. I get it. But my whole problem is where do we start interfering in the business of other boards? Will the next thing be that we tell the Potsdam board how we want them to approach things? I also am not familiar, and I could be wrong about this. I don't believe anybody on this board has an MD. I think that we're crossing a line here. I would love kids to get out and play sports. Mr. Akers knows that 90% of my career was in the high school. I attended sports activities. A lot of my students were involved in sports. I have nothing against people playing sports. That being said, I feel really, really confused, and I don't think it's our place to tell a school board or a group of boards or Section 10. And by the way, they're working on this. They didn't just toss it out the window and say, forget it, you're not going to do it. They're working on this. It was in the news today. We need to allow them to go through the process. I was very impressed by the kids and the parents that came and spoke last week. I get it. I know about the mental health impact, but at the same time, I think we're getting out of our lane and we need to stay in our lane. That being said, I don't know how to vote. I mean, if on the one hand, I'm the Grinch if I say no, but the other hand is this is something that we should stay out of. They're working on it. So what I've chosen to do, and there's a difference between recusal and abstention. I will abstain, which allows me to participate in the discussion, whereas recusal doesn't. And I will abstain from voting on this unless we choose to pull the resolution completely, given that these autonomous boards are working probably as we speak to resolve this situation. Thank you so much.
Thank you. Ms. Curran.
So everybody mentions that since March of last year, which is almost a year, we've been curtailing people's activities, kids' sports, kids didn't get to graduate. And I have to agree with both Mr. Agritz and Mr. Arquette that the kids have a price that they're paying for this in their mental health. Section 10 is not participating, part of Section 2 in the state is not participating, part of Section 7. However, places like Syracuse, Rochester, Buffalo are out playing hockey in much higher percent positivity communities. And although I am only a nurse practitioner, I will tell you that what I see in the community with kids are not the same kind of illnesses that you see in complex older people with multiple comorbidities. And I just think that this is something that they should be allowed to do as play. And I would ask that I be added to this as a co-sponsor to this resolution, please.
So noted. Mr. Reagan.
Thank you, Mr. Chairman. Last week, Trent Sargent, a student at Ogdensburg Free Academy, spoke, and I was very impressed with the comments he made about the impact this was having on his fellow students. And I think we should listen to young people like Mr. Sargent, who are telling us that too many of our young people are sitting home alone, sitting on the couch, wrapped up in themselves, and need this opportunity to spend time with their peers. I believe that we are not ordering Section 10 to do anything. What we are doing is adding our voices to others to urge them to look at how many other school districts have moved in this direction and are providing this opportunity so that our young people can be spared the risks and the very real risks of social isolation and the mental health problems that come along with that. Athletics have been proven over and over again to provide students with a reason to stay in school, to stay involved, to learn very essential skills that they need going forward. And so many things have been taken from these young people over the past year. I applaud the sponsors in saying, let them play.
Mr. Forsythe?
Thank you, Mr. Chair. Ms. Haggard, I won't let you be the Grinch. I'll be the Grinch. As a former student athlete, played all my life, competitive neighborhood, I get it too. I understand it. I lived for it. I still live for it. I love competition. What we're doing is we're picking one group and saying, okay, you guys are good. You guys are safe. North Country Now did a survey the other day, which I don't pay a lot of attention to, but I happened to notice this one. 62.3% of residents that took the survey said, what are you talking about? Are you crazy? Don't do it. Seniors can't visit the people in nursing homes, can't visit your relatives, can't visit your grandparents, can't visit your wives or husbands. But we're going to pick a group of individuals for the sake of hockey or basketball or whatever, and they were all well-spoken. Trust me, I get that. I get it. I'm going to vote no, and I realize we're just appealing to Section 10, but what we're doing is making a statement at the same time, and I don't think it's our place to make this statement. It's been a tough one for me all day. I just been thinking about it all day, and we're finally rounding the corner. The curve's going down, and here we're going to say, and basically the seasons are over. November, December is when hockey, basketball, and all these seasons start. Here we're mid-February almost. What are we going to get? There's not going to be fans. There's not going to be playoffs. What are we going to accomplish except feel good about our vote? So I will be the Grinch tonight. Ms. Haggard, if you'd like to join the Grinch, join in. But I'm going to vote no to this, but thank you.
Mr. Smithers.
I'll chime in my opinion. I've been wondering all week, basically, why we had people come last week and speak to us, appeal to us for their sports extracurricular activities. I was on the school board in Governor for 12 years, so I understand your comments, Ms. Hagan, and I realize it is their jurisdiction. So why did they come? Why did they come to us? I think they're frustrated. Perhaps they've been to their local school boards. They feel they aren't being heard. They're reaching out to us. I think this resolution is just showing them that we heard them. We agree with them. It's not our decision, but we support them and we appeal to them to let them play. Certainly, for me, there is a risk. More, as Kevin said, more and more of the science is showing that the risk for children, teenagers, is much lower than it is for the senior citizens. I have to weigh the risk versus the benefits. I think the benefits far outweigh the risk. So for me, it's worth it. There's so much to be gained by sports and their participation, mental health, and for schools being open. The children should be in school with safety in mind. There certainly is a risk, but there's much more to be gained by encouraging them to have schools open and be in school. So I'm going to support it.
Thank you. Mr. Denisha.
Thank you, Mr. Chairman. I thought long and hard about this. Actually, I was asked during the week if I would support a resolution. And my response was that I am a strong supporter of school athletics. Certainly understand the value as a parent, as a grandparent, and a participant many years ago. This hits home for me because last year I had a grandson that was a senior. He ended up scoring 1,100 points in his high school basketball career. And because of the pandemic, he was denied the opportunity for the playoffs. He's facing the same thing this year. He was fortunate enough to go to school, secondary school, and they're facing the same thing there. I appreciate the comments from the student athletes. They were all respectful, passionate, and I thought it was a great. They felt this was a good avenue. I think probably their only avenue, because I suspect that they've talked to their schools and felt they weren't getting anywhere. All that being said, the burden is on the Section 10 athletics governing body in the individual school districts, not the Board of Legislators. I would certainly support a decision by Section 10, excuse me, and the districts to move ahead, providing they follow the established guidelines. But I, like Legislator Haggard, am conflicted. As I said, it's not the Board of Legislators that is responsible for this. It's Section 10 and the individual districts. When the time comes, I will not abstain because I don't think that would be right. I need to vote my conscience.
Mr. Burke. Rick?
Well, I wholeheartedly agree with Margaret and what Dave said. It's not our position. I mean, who are we going to tell next how to run their business? There are two main players here. It's our public health department and the school districts, and BOCES as well. And I guess the assumption is that our school districts don't care about the things that we talked about tonight. They is the assumption that they need to be told how difficult this is for student athletes, the social isolation, all the things that have been discussed tonight. I believe that our school districts know this all too well. And again, here we are making a recommendation or encouraging a particular course of action. Do we know how our own public health weighs in on this? I know they sent the guidelines, but those guidelines had a whole series of specific recommendations. What's their comfort level with this? And again, maybe that's not even relevant. The real deciders here, the real decision making, is done by Section 10 and the school districts, and I feel we're overstepping our bounds. I don't think it's an appropriate thing to do, and I guess what I would say is, what next? Are we going to start telling business owners how we think they should run their business? That's just my point of view. I'm debating whether to say no for my part or to abstain like Margaret. But one way or another, and this has nothing to do with my personal feelings. This has to do with board action and what is appropriate for board action and what isn't appropriate for board action. And I feel this is not appropriate. So I won't be supporting it.
Mr. Perkins?
Thank you. I do believe it is our business. I've had numerous people reach out to me asking for their support in this, in schools, to open schools up. It doesn't go far enough. A study from the CDC published late last month found little evidence of the virus spreading at schools in the US and abroad when precautions are taken, such as wearing masks, social distancing, and ventilating rooms. 1 in 7 high school students have contemplated suicide. 1 in 5 middle school students have contemplated suicide. The Center for Disease Control Director Robert Redfield said in a Buck Institute webinar that suicides and drug overdoses have surpassed the death rate for COVID-19 among high school students. Redfield argued that the lockdowns and lack of public schooling constituted a disproportionately negative impact on young people's mental health. They're not living anymore. They said that. They used to have a life. They don't have a life anymore. It's really hurting them. FDR said in his first inaugural address, the only thing we have to fear is fear itself. We need we need to start taking our lives back. The CDC director, Rochelle Walensky, said there's an increasing data to suggest that schools can safely reopen and that the safe reopening does not suggest that teachers need to be vaccinated. We talk about the science. That's the science. They're talking about it. And Mr. Burke, we are telling our businesses what to do. We're telling them when they can open, how they can do it, who's going to be closed. I think it is, and I think we need to stop living in fear, because all it does is paralyze the whole country. We need to start. In the schools, it just shows that the students don't spread the virus. We need to give them their life back. They've already lost too much. I will be supporting this, and I'd like to be added as a co-sponsor, please.
So noted. Is there anyone who hasn't spoken yet that wishes to speak? Mr. Sheridan.
Mr. Chairman, my concern is what I heard the other night as those students all talked to us about how they, as Mr. Perkins just pointed out, don't feel they have a life anymore. It's a pretty routine schedule they've been on for the last year, especially at their ages. And I can imagine how they must have all felt on that January 22nd day when the news came out that the governor had made the announcement that high-risk sports may resume. And then the days go by slowly, 1 day, 2 days, 3 days, 4, 5, 6. On the 7th day, finally, the section 10 says districts are not ready to begin. And of course, day 11, 12, our guidance came in from our county and the other county. And then we find out this week that they're going to evaluate it more and continue to work on planning. Well, I'd like to know what more they can evaluate. They must have an awful lot of information at their hands already. They should be able to follow the science at this point without waiting any longer for these kids to have their sports. And so my suggestion is we're not telling these people what to do in the school districts. All we're doing is, I think when I vote for this resolution, suggesting that you don't take a heck of a lot more time on your evaluating and planning and so forth. Make a decision, because this season is going by fast. So I'll be voting in favor of this resolution.
Thank you, Mr. Sheridan. Ms. Terminelli.
Thank you, Mr. Chairman. I don't know why I have such a hard time unmuting that. I would like to say I too am in a quandary over this resolution. I wholeheartedly think that sports should be brought back to schools. I think that we can do it safely. But like anything else, reopening businesses, any of that, to make the plan and to ensure that it was going to be safe and it could be adhered to and that it was realistic, took some time. It's been exactly a couple days, over a week, since the decision was made that our public health department would allow sports, would I guess adhere to allowing sports to go forward. But we are not in isolation. Our teams play against teams from other counties, and those other counties have stringent rules on positivity rates. So I think the big appeal right now is to appeal to the people in our communities to consider following the 5 pillars of safety so that our infection rates go down, so that these kids can get back to sports. Their social emotional well-being is of utmost importance right now, and they do need something positive to look forward to, and they do need to be able to socialize and interact with their peers, even if it's at a distance or through sports. I know that schooling right now is not traditional in the sense of group work and activities like that. I will say that I've been in conversations with constituents in my district since Friday when the announcement was made, and it was panic. It was chaos and bedlam. The thought that they were looking forward to getting a schedule of practices and then finding out that they, by Section 10, were not going to be able to play. And so, like these parents do, they are their children's #1 fans and cheerleaders. They rose to the occasion, and by Saturday morning, they had in place the opportunities to show up on Monday at the Public Health Building, and they had already planned to come to before the legislature on Monday evening. It was Saturday afternoon or Sunday morning that the press release came out that the county, St. Lawrence County Public Health, was supporting sports and left it to the schools to roll out their plans. Now, I don't know if any other legislators have been in touch with their school districts or been monitoring, but I know in Messina, our plan is going before the Board of Education on Thursday night. And it will be up to those members of our Board of Education to approve that safety plan. But whether the plan is approved by the board or not, there can't be games until the positivity rates go down in Franklin County. We're just hovering right above, and if we continue our decline, we'll see that coming. But theirs is quite, it's significantly higher when you're thinking about a 4% infection rate to be able to practice. The athletes and the families that came to speak in front of us, they used our floor as an opportunity and a platform to reach out to those school districts and those school boards to let them know that playing safely was an option and it was something that they would be able to do and that these kids could do it. They wanted it that bad. With that said, appealing to Section 10 on February 5th updated their statement that once the plans were in place, they've given the go-ahead to districts to go ahead and continue practicing. So my hesitance to not support this resolution has nothing to do with the resolution or where we've appealed to the state, we've appealed to other people for other things. Mine is more because I don't want, if when sports go forward, I don't want these athletes and parents to think that it was these 15 people that I'm looking at right now that gave them the power to move forward or that we gave the nod or okay. The appeal was done by them, and they've done an excellent job. Those parents and athletes have shown up at Board of Education meetings. They're planning to show up on a Messina Board of Ed meeting on Monday night via Zoom. They have appealed, and their voices have been heard. They don't need our nod or our support to do it. Public health has sanctioned sports moving forward. It's about the 5 pillars now, and it's about getting that positivity rate down so that they can move forward. So I like Legislator Haggard, I'm thinking about abstaining, not because I don't support the resolution, but they don't need us to support it for them to be able to have their voices heard.
Thank you, Ms. Terminotti. Is there anyone else that hasn't spoken yet? Ms. Fiacco?
Thank you, Mr. Chairman.
Go ahead.
Thank you. I'd just like to share, I have a hard time with this. I feel like this is my job as a school board member and not as a county legislator. Especially being a former student athlete, the emphasis needs to be student athletes. These kids are not in school 5 days a week, but you want them to participate in sports. So if the other extracurricular activities come to us, are we going to go advocate to the school boards for them and help them with the appeal and all that? Because they're not getting any of it. If you can't do it over Zoom, you're not meeting in person.
Mr. Fay.
Basically, I've been involved in sports all my life. Either the head coach or assistant coach and working with Pee Wee teams and all sorts of teams all the way up through. And I'd like to point out that these kids are playing sports. It's a structured situation. In a structured situation, I'm sure with any coach there realizes if it's not structured, he's not going to have a job or ability to coach. And the kids all know it too. They were there last week to tell us they wanted to play and they would live by the rules. At this point in time, I agree. It's not our job to tell school districts which sports they can have. I think it's our job to tell us that some people in your district or in my district would like to see them at least have the opportunity to do the rules. And I will be voting for this resolution. Thank you.
By my count, everybody's had the opportunity to speak. Mr. Akers had his hand up during the time that others have spoken and since he spoke. So I'm going to recognize him once again, and then anybody else that wants to address this body. Mr. Akers.
Thank you, Mr. Chairman. So it seems like a lot of the stumbling block is about not actually focusing on the word about appealing, that it's looking at a directive. So if somebody wants to put in, hey, we're not telling you what you have to do, this is what we just would like you, we wish that you would support the students. But I listened to the students. I think we all felt their pain. They presented it extremely well, particularly Mr. Sargent. You saw the mother of students appealing, to us. And we do lots of resolutions that suggest to government officials or whoever to move ahead with this. We've been basically here in New York State living our lives, but what's been these executive orders since March. This is actually an executive order by the governor that says that high-risk sports or deemed to be high-risk sports can actually be, based on these guidelines, can be conducted. So the problem is that the poor students, they were told in January that, and this is what Mr. Sheridan said, that they could do so, and then they got turned down. Now, I believe Section 10 doesn't meet again until the 11th. So the students have already lost 2 weeks. And I think this is a lack, this is my own opinion. It's not a board opinion. I think it's a lack of planning on their part. And maybe they're actually hoping that the time runs out of these kids. And all along I've been saying, let's deal with the science. I mean, we were told early on by Fossey that, don't be wearing masks. Now we wear masks. Now you get the federal government saying, don't wear just one mask, wear two. Well, if you can really do it, wear three. Now, where's the science on it? So I think before we get into the medical part of it, which I don't want to get into, but I think it's a good point. Nobody on here is a doctor. It's appealing, I think, what Mr. Perkins said. This is a CDC. We've been relying on the CDC for much of this information. There's been no documentation, objective documentation about how this is actually affecting students in grade school and high school. From the social part of that, the rates of suicide, the actual numbers. And I think that this is just a support of our students. And certainly if they can play hockey, it's not specific. Certainly these were hockey people here, hockey and basketball players. But, swimming's being affected, drama clubs, and all these other functions can take place with masks. You can go to a Walmart, and have 1,000 people in the store, but you're talking, we can't run a school play with 10 individuals socially distanced or wearing masks or whatnot. And I think, so I don't want to get hung up. I realize that many of you will have a quandary about us giving them direction. And I truly just mean this resolution is an outpouring of support and appealing to Section 10 to give the kids an opportunity to play. It is an executive order. It's been deemed that this can happen. Let the kids prove that they can happen. As far as the rates of infection, you talked about the rates of being 4% or 6% or whatever else. That's in the community. What are actually the rates in high school students? We're going to be in the fractions. We're going to be in the decimal points. I mean, I don't know how many students we have. I'm sure that somebody could tell us, but I'll bet it's less than 100 kids in our 17 or 18 school districts. So I would appeal, with the word appeal, to my fellow legislators to support the students in this endeavor and let the children play.
Is there anyone else that wishes to speak? Mr. Arquette.
Thank you, Mr. Chairman. I just want to say real briefly that, the notion that we shouldn't tell other boards how to operate, or it's contrary to, and somebody else had said this earlier, but it's contrary to every resolution that we send to the New York State Assembly or the New York State Senate and many other boards, economic development boards. We send, an urgence, our opinion, and it's on behalf of constituents. So, I certainly don't think this resolution intended to reinvent the wheel or open our children up into any further dangers. We were approached. I believe that, again, we're appealing to a board with the opinion of this body on how to proceed. So I'll continue to support the resolution.
Anyone else? I'd just like to take the opportunity to say that it's definitely a topic that you've obviously all looked at, listened to the presentations the other night here by the high school students. And I think that what we have now is a vote on something that is asking for consideration. It's not ordering anybody to do anything. It's not suggesting anything other than what those who supposedly know more about than we do in 35 counties have said that it's okay to do this. I think too that we should be voting and not abstaining, and I'm certainly not trying to twist anybody's arm, but I think you're here because the people that elected you thought that you would stand up for what your convictions are. And I think that, right or wrong, indifferent, and I'm an expert at this, I will tell you that I will always vote for what my convictions are, and I don't care who it bothers or who cares. But I think that we've got a duty to do that. That being said, I respect anybody that doesn't feel that way. So I call for a roll call, please.
Lightfoot,
Yes.
Reardon,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
I withdraw my abstention and I vote no.
Piacco,
No.
Burke,
No.
Arquette,
Yes.
Terminelli,
On behalf of my constituents, yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
No, I'm sorry, Kel.
11 yes, 4 no.
Resolution passes. Moving on now to a presentation, I believe, by Cynthia Ackerman. Welcome, Cynthia.
Well, good evening, everyone.
Good evening.
With all the changes coming to child welfare and the Family First Preventive Service Act, I thought it best to start providing a little bit of education to all of you, some information on exactly what Family First is. There's a lot of pieces to it, so I've done my best to try to, at least tonight, just give you, to take a plethora of information and kind of narrow it down to kind of a start, just to give you guys an indication as to, what it is and how it will affect the department and kind of what our plan is moving forward as we start to implement this process. So I'm going to try to make it as painless as possible and as short as I can. So in 2018, the government passed the Family First Preventive Service. And with that comes some basically mandated criteria that we will need to follow in our child welfare programs. So the purpose of the I'm just going to say Family First, so I don't have to go through the whole gamut of it. So the basis of Family First came about due to the influx of kids in care all over. It's not just us; it's everybody seems to be having that issue. A lot of kids, a lot of things going on. So they decided that what they would do is come out with the Family First Act and then try to put some mandates in place that will help child welfare follow more of a timeline. And with that timeline, to put in more specific services for children so that we can get the children either get them through preventive services so they're not in care, B, get them, in care and then out of care as soon as possible, or C, get them into a kinship type setting where they're, with a family, a relative, someone in that type of situation, so it's less traumatic on these children. So number one was to reduce the number of children entering care. Number two was to increase the use of kinship. Number three is to reduce the number of children in congregate care settings. Currently, right now, they would like the number to be, by October 1st, 2021, for congregate care, they would like the number to be 12% or less. And right now, we are sitting at 15%, although I feel like that number is slightly skewed because we have so many kids in care that right now we have about 34 children in that type of setting. So we need to bring that number down and bring them out of that sooner than later. Right now for our children in foster care, kinship, they want that number in October of 2021 to be 50% or more. And right now we're sitting at about 34%. So we're not too far off, but we're off enough that by September, I'm not, it's going to take a little bit of strategic, work to kind of develop a plan and get through that so that we can reach that number. Because by 2026, they would like to see the number of kinship up to 90% if possible. So that's going to take a lot of work and planning and a lot of training of our staff. So two things that we have to look at. So with Family First and reducing our kids in care and reducing our kids in congregate care and increasing kinship, two things are going to come into place. One, which is a mandate, is called a qualified individual, a QI. That person basically is a licensed clinician. And what we're hoping is that, and these are more for the kids that are going to be in the congregate care. So the qualified individual, this licensed clinician, is going to have to assess each person going into congregate care within 30 days, develop a plan, and they're going to have to determine a short-term and long-term goal to make sure that that child necessarily needs to be in that type of setting. So that's going to help us dramatically. Our only concern right now with that is, and we're basically reaching out to the homes and programs that we do utilize at this time to see if they are going to be providing that type of service. And maybe we just do an MOU with that, or if that's a type of service that we have to have ourselves. That's something that's kind of unclear right now. So we're seeking that out. But again, that person's going to be following them strictly to make sure that they're, in that program only as long as they need to be in that type of program. And I also believe that if a child if someone new is going into that type of congregate care setting, that it's going to have to be approved not only through the assessment of the qualified individual, but also is going to have the stamp of approval from OCFS. So there's more to come on that as well. Second is it's going to affect our Title IV funding. The Title IV funding is funding that is provided to children based on their parents' income level, so low-income homes. So children that are forced into foster care, that their parents would qualify for the Title IV funding is something that's going to be strongly affected. For children that are going into your typical foster care, this funding normally can carry these children pretty much indefinitely. And the reimbursement rates are anywhere from 62% to 85%, depending on the service that those children need. So whether it's a mental health service, sexual counseling, drug addiction, anything like that, these different types of services, along with some maintenance. I believe the maintenance payment is the one that's 62% reimbursed. Right now, the Title IV covers. Now, the children going into typical foster care at this time, once October 1st comes, that's going to be cut to only 14 days. After those 14 days, we have to have proof and documentation that any child that continues in care needs to be there. So that's when we need to look at, the kinship. We need to be looking at permanency. Is this going to be a child that is going to be able to remain, or go through a type of preventive service to be back with the family and reunited? Or is this child going to be a child that's going to end up with the parents losing their parental rights? It's actually speeding up that process by putting those types of, restrictions in place by affecting your funding. So with those two things said, for the Family First, those are basically our biggest two, I would say, obstacles at this time, is kind of looking at reevaluating the children that we have in care at this time, because we have children that have been in care 600 to 700 days. So we need to start with those, get those kids out of care, look at, whether they we're going to be able to reunite them with their families, or that we can reestablish the kinship relationship, take the time. There's actually a pretty stringent process for assessing kinship. It has to be done. It has to be documented. And you even have to go into a search system to make sure that there isn't anybody else out there that might be related to this child that might be able to be a potential caregiver. So there's a lot of, I would say, factors involved with this process, but I really wanted to be able to kind of give you guys some insight as to what the project is as a whole, because we are a little late on the project. This should have started back in 2018. There are some of the things that were completed at the time, but I think looking long term was something that we should have done a little bit sooner. So we're going to have to do a lot of training with staff. We have to kind of change the way that we're doing things, basically change the culture and the thought of our staff on third floor, so that we're gearing things in a different avenue. So we are focusing on kinship, and we are focusing on, these kids only being in care as long as they need to. I think sometimes we still run into the, predicaments of where we might have a child that's in care and it's going well, there's really no issues. So we have a lot of other things that we're focusing on, instead of making sure that we're meeting these timelines with these other children that now are in care for, a year, 2 years, 3 years. So there's a lot of things that we need to look at. Just want to kind of check through my notes to make sure I didn't want to give you guys too much, because there's a lot more involved in it. But our thought was kind of that maybe I would spend 5 or 10 minutes at every services meeting, kind of going over where we are in the process, kind of we are actually doing a strategic plan to work through this, so that we have everything in place in a timeline, so we know what we're doing, so we can continually reassess and kind of look at what's happening, during the current time. I've also been doing a lot of outreach to look at some studies. I have a sister who is she teaches school psychology. She's a psychologist in Buffalo. So I've asked her, to help me do some research. She has access to a huge database. So, I've kind of been able to, obtain some research papers. So I'm looking a lot at casework, caseworkers, different studies like that. And I know that we've always also talked about, that there's a mandate for caseworkers to only have 12 to 15 cases. So in some of the research I read recently, it's not a mandate. What it is a recommendation by the state. So the state says, okay, for the average caseworker, we're going to say the average caseworker can do 12 to 15 cases. The average foster care worker can do 11 to 12 children on their caseload. They don't want to make it a mandate, because if it's mandated, then if I have a caseworker that maybe can take on a few more cases, I want to be able to do that. I want to be able to open to say, hey, I've got 4 caseworkers here that are, I don't want to say better, but maybe their cases are a little different. I can give them a few more. It can help us over this curve till we get, things flatten out again. So that's why it's not mandated. And I have to agree with that, because I do like having, the opportunity to be able to utilize the program in that way. So I think too, focusing on our staff and who, you're going to have your caseworkers here and in the middle and in the top. So how can we work on training and understanding our caseworkers and how they work best? So that's also going to be another part of our strategic plan as we move forward, is constantly reassessing, talking with our caseworkers, trying to be more hands-on and building those relationships with them, so that we can then build them into our plan moving forward. So with all of this, you are going to see that there are quite a few positions that I put into vacancy. We did decide to put some of them on hold, but looking at them, I just want you to think about the long-term effect. Bringing in some of these workers now, in little bunches and getting them trained on Family First so that they have the idea moving forward of what the program looks like and what we need to do to get through it. I think we're going to start seeing the shift in our kids in care and our kids, getting these kids in kinship. And I think in the end, it's going to come more favorable for the department. And I think too, in the end, once we, if we get a few staff, we can reassess, see how it's going, see how everybody's working, and then redetermine, okay, is this working? Or are we still a little short in this area? Or is there maybe some people that might be better in this area than this area? So I think it's just a constant awareness and assessing of what we're doing. And then once we meet a kind of an even ground where we're balancing out, then by attrition, we can start then on the end, as people retire or move on, which is always, right now it's a pretty consistent 12% each year, by attrition, letting some of these staff, these positions go so we don't need them. But, and as I think Ruth is going to speak to with me a little bit later, talking about kind of this pool of staff that we have in almost like a constant training mode to help backfill, or if somebody's out on FMLA or out on medical leave, so we don't end up in, in this type of crisis situation that we really don't need to be. So I just kind of wanted to put that out there. I'm certainly open to any questions. I know there's a lot more information to provide for you guys, even still, but I again I wanted to give you enough information so that you could think about it and that it would actually start to make sense as you can start seeing kind of how we're trying to develop, a program that's actually going to work within the department to kind of help fix, or I always say tilt the seesaw, so to speak, to even it out. So.
Any questions?
Mr. Burke has his hand.
Mr. Burke.
Cindy, could you maybe just highlight for us how this benefits children and families? I think you touched upon it to some extent, but I guess, where will we be moving from? If we're at point A right now, what is point B going to look like, and why is that better for children and families? And maybe the second part of that would be, why is it better for taxpayers?
So the reason why it's going to be better for families is because what they would like to do is have this be more of a team approach. They want every child that comes into care, they want there's going to be like a team. It's going to be more of a person. You're going to have your kinship person there that's going to help you navigate through trying to find, working with the family to find a kinship placement if we need that. We're going to have our preventative service person in there so that we can look at that. If it's someone that's potentially going into residential placement, we're going to have that qualified individual, which is a licensed clinician in there as well, helping to provide some feedback. And we're hoping that the group as a whole can kind of stay with that family. And I think we've talked about this team approach before too. So, in looking at all of this, we're still talking about doing that team approach so we can, have, 4 or 5 people that would be there to kind of support the family instead of one caseworker, that has, 30 other cases and trying to keep up, but yet it's more of an encompassed support for that family. So that's kind of more of what Family First is all about, is developing that type of structure for each child as they either come into care or come even into preventative services, developing that type of structure.
And will that save money, Cindy? Will that approach save money?
I have a strong belief that if you look at the funding that we're paying right now for children in care, even our children in congregate care, you're talking up to $700, $800 a day. And some of our children that are even in our, highly structured programs that we have right here in our county, it still can be, half of that plus. And I think getting the children, with the time frames for Family First and being able to get the children or actually, you know, being put on a time frame to get these children out of care. But we've got to be able to have the resources to provide that service to the families so that we can, you know, I mean, right now we have 340 children in care. You know, we have already up to 54 calls already this month to our CPS line. And the thing with that too, and I think a lot of the stuff that you guys talked about tonight, a lot of our calls coming in are, you know, increase in domestic violence, you know, increase in mental health issues. The calls aren't, you know, what they used to be. They're becoming more and more severe. So it's taking, you know, a little more time. It's more stressful on the caseworkers. A lot of scenarios that I think that, you know, COVID, of course, is another huge factor, you know, piece in the increase just of the severity of the cases. I think in the end, we could save the taxpayers a lot of money. You know, a part of, and we can talk more later, but part of this program is having more home finders. The field right now is set, the foster homes are saturated. There's not even, you know, any foster homes for children. So children end up getting placed in higher needs settings than they need to be. So that's another piece of the Family First, is they are really trying to put a stop to that. You know, open more homes for children. Hopefully they are. So it's that type of avenue that we would really like to take.
Thank you, Cindy.
Anyone else? Seeing none, just a comment or two. In my reading of this, the main thrust of it is, and I applaud the federal government for setting some of these guidelines, because what it does is requires the state and the state to the counties through their Department of Social Services to cut the number of children that we have in a custodial setting, if you will, by a rate of 50% by a certain date, and see to it that these children are placed with their families. That's the whole idea of the name of this, Family First. Get these kids with their families, and if not with their immediate families, with their expanded families. And it can even be stretched further so that somebody that they may have taken a shine to or a liking to growing up, at least, you know, given whatever stage they're at, that they could be housed with them. Mm-hmm. And there's a whole process as time goes by once this gets started. This was supposed to get started right now. Right. And the state got a delay to the end, I believe, the end of September of this year to get this thing up and running. The details are quite staggering. Yes. About what has to be done. There's still questions in my mind about who has to be doing this, who has to appear at these sessions, who's going to run them, what the protocols are. There's a lot of what ifs. Mm-hmm. So the whole idea, the big idea behind this is keep these kids with their families, mm-hmm. not somewhere 200 miles down the road or in a structured setting where, like the one we visited in Albany, where there was one child present there, one child in this secure detention facility. Mm-hmm. So they've also trying to put a shine on what we already have are the foster parents. Mm-hmm. And they're looking at not only retaining the ones that we have, but helping them with issues that they have. And I don't mean with the, you know, the relationship with the children, but maybe financial, maybe fuel, maybe, vehicle repairs, things like that. And developing new foster parents, okay? And I had a question, Cynthia. the state, probably through the federal government, has a $3 million pot that is aimed, because of this, to do those very things, to train, to retain, and to develop new foster parents. And I'm not going to put you on the spot tonight to ask you whether St. Lawrence County has dipped into that pot, but if they haven't, I think it's worth looking into, because it's my understanding that we have need in St. Lawrence County for more foster parents. So I would strongly suggest that, and I truly am not looking for an answer tonight. I would ask you to come back with an answer in the near future. But listen, this is workable, okay? My only issue is that we're not throwing bodies at this willy-nilly, that we are taking advantage of whatever monies that are out there to help us with this. And I think it is so smart to try and keep these kids in the home. And I full well realize that that can't happen all the time. But if we can keep them close to home, close to where they live, close to where they go to school, close to somebody they know, it's got to be a better way of doing things. So I at least at first glance, I support this. I guess it depends, the devil's in the details, as I've often said, and we'll have to wait and see how that works out. But thank you. I don't see anybody else. Yes, I do. I see Margaret Hager with her hand up. So she must have a question for you.
Thank you, Mr. Chairman. What I'm hearing is this is better for kids, and eventually this will save us money. That's a no-brainer. Is that how you see it, Ms. Ackerman?
Definitely. I mean, bringing our kids out of care. You know, I mean, I think we've had obviously concerns prior to this, and then, you know, realizing this whole family first thing, it's actually going to help us. Getting through the process with Family First is actually going to help us with you know, balancing out getting these kids out of care. I think you know, as mentioned, it's really going to help us speed up our process of what we need to be doing anyways. You know, putting some stringent timelines in place, and I think a lot of it is going to be retraining, and then like I said, it's going to be changing the culture to be family first focused.
And just to follow up, Mr. Chairman, if I may.
Certainly.
We're providing jobs to community members, correct? So there's kind of like all these good things that can happen.
Right.
Is that correct? Okay, good. Thank you for your presentation.
You're welcome.
Any other questions or comments? Seeing none, thank you very much, Cynthia. Very informative.
Thank you.
Have a great evening. Moving along to vacancies.
Yes. Vacancies, certainly one of our longer lists. I think as we started a little bit of the discussion there, there are 4 departments this month. We had 25 requests to be considered, and you will have 16 of those before you this evening. Insofar as we're at the 6-month mark, as you'll recall, we track August to August. We're at 77 positions requested. So if you were, you know, on a trending basis for this year, to look at that, you'd look at about 144 positions, still behind our average of between 150 and 165 to 70 on an annual basis. That's trending at about 12, almost 13 positions per month that we're looking at. And we're looking at right now an immediate fill rate of about 66% of 51 of the 77. 9 have been held, or 11% for the 30 days. 5 have been held for the 90 days. And then we're looking at the ones this evening that are being held for further consideration. So not trending too bad. I think looking at our goals for filling positions, getting the help in that's needed. Certainly this year's an anomaly with some of the part-time positions that we've put into place to assist with the public health efforts. So we hope that overall the efforts that are present and the filling that's being requested will be taken seriously in consideration. So that being said, on this agenda, there are 2 departments. The first is Community Services. And Jay is with us. Jay, the first one is the Abolish and Create.
So this is, I had it the other way, but that's fine. This is a keyboard specialist position. We have an account clerk that is resigning. She, due to personal reasons, she hasn't been able to work for a year. So she is choosing to resign. And if you recall, prior to COVID, we had turned some of the keyboard specialist positions into account clerks, thinking that we could place them in some of the outlying chemical dependency or addictions services sites, and so that they could not only man the front desk or tend to the front desk, but also do the billing component for that particular clinic. And also we had hopes of increasing our copay and self-pay collections at the time of the visit. So when COVID came, our walk-in traffic went virtually almost to nothing. And so those account clerks were really doing mostly keyboard work in the new environment, with the virus. So in moving forward, we'd like to restructure and get a little more balanced ratio between account clerks and keyboard specialists, that being 3 account clerks and 3 keyboard specialists. There would be a cost savings because it's a grade 15 rather than a grade 16. The person leaving was on step 6, so it'd be a county cost savings of about $4,700, $4,800. But I just think it just meets the current need and structure of our front office situation.
Any questions for Jay? Okay. Jay, go on to the second one. And if Cindy, if you're there, since this is co-location program we're talking about, just so you can augment any of the comments or answer any questions, that would be appreciated. Go ahead, Jay.
Okay, this is a create and fill for a chemical dependency case aid. And this case aid would be embedded or actually located in DSS and be working with CPS, Child Protective Services. Currently, we have a senior chemical dependency case aid and then a second chemical dependency case aid. So we're asking for a second chemical dependency case aid. If we get this position, the plan would be for the 2 chemical dependency case aids to divide the county because they're in the field a lot. They're doing toxicology tests, court-ordered toxicology tests for families that are struggling, particularly parents struggling with addiction issues. So, and the senior chemical dependency counselor would be more available to respond to creating plans of care for mothers and infants, newborns in hospital settings that are testing positive at birth. And also, it would also free up the senior chemical dependency case aide, who is a CASAC-T now, which is billable position, that she could actually do the full assessments. They wouldn't be identical to the assessments that we are doing, in our clinics, and we would try to make that a billable event rather than doing the shorter version of the assessments that are not billable. So we're trying to, transition that. We're trying to work with Oasis. It's called Pick'em. It's their financial arm, and get approval for that. If we do, we'd have to have her set up with, our electronic health record and IMA and so forth. But that's the goal we're working towards. This is 71% state reimbursement from the Office of Children and Family Services. That's their standard reimbursement rate for children's services positions. So I don't know, Cindy, do you have some numbers to share with the board?
Yeah, what I can do is I can kind of add, so as of last year, they did over 1,500 drug tests. And that was in 2020. No, that was in 2019. In 2020, they did 2,300 drug tests. So you can see the difference. Another part of this is when we first brought Children's Home in to help us providing services, they used to do a lot of the drug testing. They no longer do the drug testing. So now everything that the Children's Home was doing for us, they no longer do. And what happens is it costs us about $3 a test to get the drug test. And these are all court ordered. They have to happen before visitation. There's others that are, mandated, weekly. The case workers have to go out and do that prior to any visitations, or because the children may be home on trial basis. But if we can't get that testing done, and these people have to go into the hospital to do it because they are court ordered to do it, it's $500 to $700 a test, and social services eats that cost. So, I think at looking at, bringing on this other assistant, having them be able to split the counties, because it is hard if you're in Messina, now you get a call, you have to drive down here. They're just responsible for their side of the county. That would allow then Danielle, who would be their supervisor, to go in, and she has been working a lot. There's times you don't even see Danielle at all. She works so close with families. She does a lot with the newborn babies that are born, positive, and with their mothers and families. So I think it just would be a nice asset, to the group, and well needed, because the numbers definitely are going down right now in regards to the drug testing.
So also, I'd like to say, if our senior chemical dependency case aide, who's also a case actee now, does the full-blown Oasis assessment, that's going to expedite their admission to clinic services. And once they are in clinic services, then we bill insurances for any toxicology tests. So it would not be on the Department of Social Services once they are admitted in receiving addictions treatment.
Mm-hmm.
Are there any questions for Cindy or for Jay? Some of you may recall this was a program that began some years ago, and it was funded in a grant status by the state. So initially, when we had one person, I believe it was just the case aide, it was at no cost. Now, certainly this is reimbursed. And shortly thereafter, the grant funding went away. But this was a program that really connected services at the early onset of referrals, as has been mentioned. And what was interesting at that time was when the grant funding went away, it was one of those conversations that we have to have with the board to say, is this a program we want to continue? And this is one of the programs that I feel pretty strongly about, not only because it gets in early on situations that could otherwise go a different route, but it also provides an opportunity with the services the county provides to refer those folks into services to be able to get the help they need to hopefully prevent the loss of their children in their care. So there were a number of aspects, and now this last year the board agreed to add an additional position. So now we have the senior position, which is Danielle that Cynthia spoke to, and then we have the case aide. They're asking for that additional case aide. I think it's a worthwhile endeavor to consider for the board because it also is a great partnership between two of our departments that care for the folks that need it the most. Other questions? Any questions? Okay, thank you, Jay.
Thank you.
Now, before we start social services, as many of you spent time with your review summary, seeing a number of positions totaling 20 this month, probably were a little bit alarmed to see so many come before you. And over a number of conversations, we've talked about, and this long precedes Cindy's presence with us, we've talked about the challenge with departures, we've talked about the challenges with civil service, we've talked about the challenges with training associated with caseworkers in general. And so in looking at this problem, which is a system problem, we also wanted to think a little bit more creatively about what we might suggest the board consider. And so in this scenario, and certainly I'll have Cindy speak to them. There's a couple unrelated to this, but then most of them go with regard to the family first. So the idea here with some of them, and it would be your numbers 3 through 7, so position numbers 30 through 34, what we would like to consider is if the board would think about allowing a pool to be created. You're familiar with the pool created in a part-time capacity in corrections and in dispatch. And it allows the part-time capacity to be an opportunity both to see if we're a fit for the employee and if the employee is a fit for us. So this scenario would be full-time positions, but what the concept would be similar in that we would be able to continuously canvass, continuously interview. Johnny has spoken to you previously about holding additional exams, which they're already doing, and a number of efforts that have been underway for some time to get at the system problem, which is we need folks that are trained, that are a good fit for us and we for them, but that also provides an opportunity when there are leaves or FMLA or challenges between fully trained staff. And one of the challenges that she's observed early on is the challenge we face in maintaining the cases and continuing to get the training. So that's an area also that potentially this pool, so to speak, would address. So when we talk through those positions, one of the things that we would consider having the resolution speak to would be that these 5 CPS caseworkers could be filled without additional board action, but on an ongoing basis to keep them filled and get them trained. So in the scenario where you've got the other positions, of which you have approximately 30 now on the CPS side, you'd be able to, at that time, still see that full-time position come before you. But the pool it would come from would be these 5 CPS workers. And then the pool would continue to be filled. The training would continue to be conducted. And the staff would then have a smaller gap between functional, trained, full caseload to new off the street, no idea, and maybe doesn't even want to stay. So the 2 areas, I think when we try to get after a system problem, we need to be a little more creative. So that, as Cindy talks through these positions and the supervisor role, I ask that you consider, and she certainly agrees, that this be a concept that we try. And if, in fact, it doesn't work, we'll come back to you with something else, because it's our job to make sure you have options when you consider these positions. That being said, we'll start, Cindy, at the top with the social welfare examiner for TA and SNAP.
Okay, so the social welfare examiner for TA and SNAP was actually a staff that was promoted right there in TA and SNAP. So what we're asking for is to refill her position from her promotion. So this is a $23,000 cost to the county, but this is definitely a needed position because examiners are responsible for interviewing clients that are applying for assistance. They determine eligibility from about 80 to 200 applicants each month. So this is definitely a position that is needed.
Questions on the examiner position? Okay. The next one is the first abolish and create for the grade B.
Okay, I got mine mixed up. Okay, here we go. Okay, so the first abolish and create is was a community social worker for Medicaid. So we're going to abolish that. And we'd like to create a grade B supervisor for the CPS. And this supervisor will be over, as you'll see, actually the next 5 caseworkers coming through. and actually we'll start with them, work with them, and kind of develop them as they come through the training process. So, and I'm sure that Ruth, may speak more to this, but we're kind of looking at this as a trial of, if we keep this grade B supervisor right where the new caseworkers, which I'm assuming the grade B is going to be somebody who is going to take a promotion, who's already in CPS, and can then, start developing these staff through and getting to know her staff as they're going. So that's something that we would like to try in this process as well, and getting this team started. There will be some people that, after a week or so won't make it. So then, hopefully this will be approved and we can just start backfilling that. But I think having this supervisor there in the beginning to work with these staff is another part of how we can be successful, with these teams moving forward.
Are there questions for Cindy? So I think on this grade B, the idea, as she alluded to, would also be an opportunity for those caseworkers coming in to be mentored by caseworkers that we have in certain areas. So in the efforts to get ready for Family First, the concept was this teaming effort where you'd get folks of different skill sets that could be trained in specific areas identified as a need in the department. So these folks would be able to understudy, to work with and support, but also during that training be able to identify, again, if we're a fit for them and they for us. And if they're not, they'd be able to move along to a different opportunity. And if we decide they're not, again, they have the opportunity also prior to carrying a full caseload and again, leaving us with no one to pick that up. So the idea here would be the grade B supervisor would be carrying on that interview, that canvas, that process, pulling in the grade A supervisors to select the individuals, but also be relieved a little bit so they can focus on supervision of caseworkers and then also of the cases that are moving through CPS. So the idea here is the supervisor will have a very good handle on, and when there are extended leaves, things like that, those folks could be pulled in and help out with that load. So we don't all of a sudden see a jump in cases that we can't manage. So the idea here would be that they would have some oversight, that they would be kept and measured constantly throughout that first year so that their training is complete and they're handed over to CPS or, if they decide, Children's Services, and that they're ready to go with a better start than we've been able to afford them. Questions? Okay. Cindy, you want to speak to the caseworkers in general, the work you'd expect of them, and then go on to the Children's Services, the kinship and the home finders?
Yeah, sure. We do have one more, abolish and create.
Okay, but that's one of the 5 CPS caseworkers, correct?
So one of the 5 CPS caseworkers is also an abolish and create, and this is a social welfare examiner in Medicaid that we are abolishing and creating one of the CPS caseworkers. This position was created back in 2019. It was never filled. So abolishing it just makes sense. And creating a position that is definitely in need. So that's one of them. The other 4 caseworkers will be part of this team. And as we talked about the grade B supervisor training these caseworkers, this is going to be our first, so to speak, team that are going to be trained in the Family First Prevention Act. They're going to be trained in, the new, all the new policies, procedures, basically changing the culture, starting with this group as we move forward. So there's a lot of different things that need to be trained. We actually also have talked about expediting our training. We actually have our staff developer that has reached out to numerous counties and talking about how can we do we're looking at more of a hands-on approach with a lot more mentoring, some real life scenario situations that they can, that this grade B supervisor can work them through so that they're actually way more prepared quickly than the other staff have been in the past. So there's a lot of that was spoken earlier, a lot of pieces to this puzzle that we're going to be working on. But I really think in the end, it's going to become extremely effective.
Okay, any questions on those? Or we'll have her speak to the kinship and the home finders.
Yeah, I have a couple.
Okay, Joe has questions. Cindy?
Cindy, right now you've got, it shows on the 1921 sheet here, 23 caseworkers. Is that correct? Is it
That's,
correct?
that's correct.
Okay. So caseload wise, what is the caseload for those people?
Right now, the case.
If you know.
I do. We just had an update. Right now, the caseloads are at 25 caseloads per CPS worker.
25 cases.
That's an average. So we might have some that have 30 or 35. We might have some of the newer caseworkers that only have like 6 or 7. So the 25 is an average overall of all those caseworkers.
Okay. So how many of those cases do you think would involve more than one caseworker with, say, the same family? In other words, if you get a complaint today about something going on within a family, and you do an investigation, and in a week from now, you get another complaint about another family member, same family, it's my understanding that that might not go, or probably does not go, to the caseworker that got the first call. That it would go to the next one in line to get a case, I guess. Is that accurate?
No, we do try to keep the families together, but sometimes it depends on the severity of the case. Sometimes it's better to separate them just depending on what type of call is coming in. You know, so the grade A supervisors kind of weigh that out because what they don't want is some type of conflict of interest. And like I said, it just depends on the specifics of the calls coming in.
Okay, so is there a mandated maximum number of cases that the state promulgates social services investigators to have?
So I actually did research on that, and there's actually not a mandate, but what there is there's a state recommendation of a minimum of 12 cases to a maximum of 15 cases. And the reason why they don't do the mandate is because they leave it up to the department to determine if there's a specific caseworker that may be able to carry more than 15 cases. You know, if we happen to finally get things evened out, we happen to go through an influx, and I'm able to give a few of the caseworkers a few extra cases, I understand and would actually rather not have it mandated that they can only have 15 cases, because then what am I going to do with those few cases while we get through that, you know, kind of wave of change? Now, if we had a wave of change that didn't stop, and then we might need to look at adding a caseworker, that would be different. But so because I couldn't understand the mandate versus recommendation, so I did do do some research on some studies that they had put out and some clarification on that.
Okay. And another question that I have is, what's the turnover rate in child protective services for caseworkers?
Right now,
on a yearly basis.
So right now we're at a 12%. I just got another resignation, so that might be higher. It seems like we've had more. And that seems to be pretty consistent over the past few years. So we actually looked at the 12% turnover versus how many staff we were actually getting in. So we were actually at a negative. If you looked at trying to get staff in and get them trained and actually working, we were actually ended up backwards because the process, we were just losing people faster than we could keep them.
Do you conduct, I'm sorry, go ahead.
No, I was just to say, so the thought with looking at a different type of training that is more hands-on and more personable and more interactive is hopefully a way that we can get the staff, you know, better trained, more informed, and ready to go so that they're not just thrown out there in giving cases just because there's nobody else to take them. Like these staff are the part of this program is keeping these staff in the training process until they're ready to go, until that grade B determines that they're ready to go.
Okay. Do you or one of your staff conduct exit interviews of the folks that are in those figures, that 12%?
Johnny does. I actually do all the exit interviews myself. I actually did an exit interview today from a CPS. This is actually a foster care caseworker.
I think it would be enlightening to the legislator, the board members here, to know, not necessarily who it is, and I don't think we want to know that anyway, but what their responses are, why they leave it. I think that would be helpful to us in some of our decision making.
I can give you an example like of the staff that I talked to today. She's been here for quite a while. I don't know the exact years, but it was quite a while. She loved her job. She loved the thought of the job. She said her supervisor was outstanding, always there for her, you know, always helping her along. And she said what it was is she had no time for family. She worked late because she had to without pay. She or calm time. She said that the workload was too heavy, and she said that it basically was, she felt like she was deteriorating, and she just couldn't let that happen to herself mentally or physically, that it was just too much, and she felt like she was not effective in her position and didn't feel effective. Like she couldn't make the difference that she wanted to make. And then that's all, we actually have them fill out a form. So she actually wrote all that stuff down on her exit form.
Good, thank you. I still think that it would be beneficial for the board to hear the reasons why it is so hard to keep somebody in a child protective service position, and that we see a turnover like that. Mm-hmm. You know, I go by my past experiences, and I work with child protective services on a regular basis, and those folks were there for years. Mm-hmm. I guess enough said. One last question. Last month, I believe either December or November, this board voted to okay a contract between social services and the county attorney's office regarding the takeover of the functions associated with support. Mm-hmm. How is that going, or is it going at all?
So where that is right now, the status is any contract that we enter, with child support has to be approved through OTDA. So actually tomorrow we have a conference call with them about the contract. So I'm going to know if they're going to approve it or not by tomorrow afternoon.
Okay. Did they give you any indication what the holdup was?
No, they did not.
Okay.
I didn't.
Thank you very much. Thank you, Cynthia.
Mm-hmm.
Any other questions? I think, Nicole,
Nicole.
Yeah.
Go ahead, Nicole.
Thank you. And I just need clarification. I don't know if I missed something. Ruth, you spoke about a pool of part-time candidates or part-time that would go through training. These 5 positions are full-time. So is this separate and aside from that pool?
Can I answer that? Can I answer?
Yes, go ahead.
Nicole, that actually, my comparison was to the existing part-time. These would be full-time. I was just using the example of how these part-time folks we have in corrections and at dispatch allow for that training and all those things to happen ahead of time. In DSS, these would be full-time.
Okay, then just one more follow-up question. How is that different than what we do now? When we hire somebody new, they have to go through their training before they take cases too, right?
They do. How this would be different is each time they have a vacancy of these position numbers, they could go ahead and refill without waiting for another vacancy, waiting for another canvas, waiting for another opportunity, probably 6 weeks out in these situations. These could just go ahead and be refilled.
Okay. All right. Sorry, I was lost on that.
That's okay. I could be more clear for sure. And then lastly was the grade A, the case supervisor position.
I don't think I didn't talk about the home finders or the kinship.
Okay, go ahead.
So the three of the other caseworkers for children's services that we're looking at are actually 100% of the Family First preventative services plan. So with that, one of these cases would be a kinship navigator. Their position would be solely seeking out kinship, and probably would start with, new cases coming in, and then, looking at some of our cases that have been out there for quite a while, in learning that process and seeking that kinship, building that relationship with the families, different from that of like a CPS case or foster care, but more of that relationship of support to the families, helping them out, trying to gather the information that sometimes we're just not able to gather. So one of those positions is for the kinship, and the other two positions are for home finders. With the saturation of the foster care homes, we are, like has already been spoken, children are being placed in places probably that are too far away, not kinship. So with these home finders, they can actually work even closely with the kinship navigator in certifying these homes, looking for these homes within our own county, and kind of helping us to rebuild our base of foster care homes, which is very important to the family first, and getting these kids, into the kinship and getting their homes assessed and certified.
Questions? Okay.
And
Now on to the grade A.
Yeah, so last I have, and I want to say that Heather Rand accepted the position of the Director of Services. She is our grade A supervisor in Child Protective Services. She has been at the agency for probably 20, 30 years, well-versed, well-educated, full of knowledge. She's going to be a total asset to our management team. She's full board with the Family First. We've been working very closely with that. So with that comes her now grade A position that will be open. So we would really like to backfill that so that as soon as possible, so that I can then pull Heather out to kind of help me oversee the process. She will be in charge of the services side of social services. She'll have the adult protective service, child protective services, foster care, adoption, and preventive services. So we just need now someone to backfill her position, and then start to train that person and separate her out of that.
Questions for Cindy? Okay. That concludes vacancy. Thank you, Cindy.
All right, thank you.
And then the only other consideration I think that we would be requesting is the pool option. And if we could get a sense of the board on the likelihood to support that, that would give us guidance for the resolution for the board meeting. Is there any objection? Yes?
I don't see any.
All right, thank you.
Thank you, everyone. Moving along, we'll have committee reports. If Mr. Akers, the Board of Health.
Well, Mr. Chairman, what we've been talking about 99.9% is the COVID. I will comment that I read in the Wall Street Journal today that the expectation with the way that things are happening around the world, that we'll be living with this for 2 more years, approximately, much like other diseases that we're facing. So I think we have a meeting either this week or next. I haven't received a Zoom invitation yet, but primarily dealing with COVID.
Thank you. Any questions? Seeing none. CDP Board of Directors. I would inform this committee that the seat on that board is directed at the board chairman or his designee. So I would defer to Mr. Sheridan if he's still on.
I have no report, Mr. Chairman.
Thank you, sir. Community Services Board, Mr. Kerr or Ms. Curran.
Thank you, Chairman. So we had a presentation from Citizens Advocate. They had brought forth a proposal to the Community Services Board about having a mental health urgent care in the Ogdensburg area and bringing a crisis center type model like they have in Malone to the Ogdensburg area. That was the initial presentation, and there was discussion, and as it moves forward, I will let you know.
Anything else?
So that really
Okay.
took up most of it.
Any questions? Okay, Office of the Aging Advisory Board, Mr. Denisha.
Thank you, Mr. Chairman. Just taking
today, we had a meeting today at 10 o'clock, and it's a very fitting for me to be on that.
Yes, we noticed that.
We did meet today via Zoom and talked at length about the COVID vaccination and the assistance that has been provided by Office for the Aging. There were, when the sign-ups became available, it was mostly, it was all electronic. And we had a large number of seniors that didn't have access to a laptop, to a tablet, to an iPhone, or some of them that did, they just didn't know, so there was a lot of confusion. Office for the Aging stepped up, and they have been handling many calls and setting up appointments for seniors. They're doing a great job. Home delivered meals were 600 clients, and there's currently about 60 on the waiting list. There are 19 routes that are currently being covered, but we're still in need of volunteer delivery people. We have 2 nutrition aid positions that are still open. Amazingly, we've had absolutely no applicants for those 2 positions. And there's a volunteer call center, which I'm sure many are familiar with, that the Office for the Aging has, and they call seniors on a routine basis and just check, see how they're feeling. And sometimes apparently there's been some friendships made, and the folks are just glad to have someone call and someone to talk to. And our next meeting is Monday, April 12th.
Okay. Thank you, Mr. Denisha. And as you well know, the choice for the position on that board was between you and I, and you got the short straw. Youth Advisory Board, Ms. Terminelli.
Our last meeting was on Thursday, January 28th. It began at 3 o'clock via Zoom due to my contract obligations. I roll in just a smidge late, but a lot of the initiatives they've established in the previous meetings, and they've just given updates on. A couple of those I'd like to highlight, one being the Valentine card drive in partnership with the Office for the Aging. Those cards are due in by anybody in the county that would like to submit them by Wednesday, February 10th to Alexa, so that they can go through the quarantine process before being distributed to our clients through Office of the Aging. They've got some workshops. They're collaborating with Cornell Cooperative Extension and some other partnerships to do some workshops. One of those being the Making a Heart Healthy Snack workshop. And that is actually this Wednesday, kind of geared towards like maybe grades 3 through 6 and it's just how to make healthy snacks using things in your home. They're also, another initiative that they're rolling out is connecting seniors and youth. So it's a St. Lawrence County Pen Pal program. And the Youth Bureau will be kind of handling the connection with that. And what we're finding is we have a lot of kiddos out there in the county that are so excited, whole classes want to be pen pals with seniors, and we don't have a lot of seniors signing up. So Mr. Denisha, I think that a lot of that could be maybe they just don't have access to the technology and they're not maybe seeing our social media boosts. So if any of you know of any seniors in your communities that maybe would just enjoy, just pen pal, good old fashioned letters back and forth with community or children in our communities and our schools, that would be really, really great if you could maybe get them to reach out to Alexa for that partnership. There are some other initiatives going on just to support youth, both academically and their social and emotional well-being. The People Project and the Buddy Project is offering some virtual tutoring and also some parent support groups. The College Connections is doing a college mentorship program that's kind of based on athletics and academics and how kids in high school can kind of maintain high academic standing while they're also devoting their time to athletics. So that's a mentorship through Clarkson. And then connecting St. Lawrence County youth. This is kind of a new initiative. It's a collaborative effort of anybody that really is connected to youth or youth services across the county. It could be, educators. It could be different programs or organizations. They'll start quarterly meetings. So they're creating a database right now, just so it seems like a lot of people and a lot of organizations are doing really great things for our youth out there, but sometimes the programs are either not identified, they're not advertised enough, or we have several organizations kind of doing the same thing. So working a little bit smarter and not harder, trying to bring those organizations together just so we almost have like a compilation or a database of different programs and initiatives that are out there that support youth and youth development and towards the workforce development piece as well. And then last thing is our youth committee. We had 2 members from the youth committee that spoke. They were on the agenda for the Environmental Management Council last month to partner with them in some environmental, they're hoping some projects that can move forward. And I can speak more about that when I get to the EMC in the next committee. But thinking about some Earth Day initiatives along with some other programming and education for St. Lawrence County and for youth around environmental issues. And I think that's about it. Our next meeting is Thursday, February 25th.
So at this point in time, we are adjourned. I'm sorry, John. Go ahead, Tony.
Under old and new business, I just wanted to give a shout out. We have some appointments under for Youth Advisory Board. Jerry Mahoney has served on that board for a long period of time. Jerry is an unbelievable community member. He's a justice of the peace. He and his wife, Mary Carroll, raised some wonderful children that became athletes and coaches. Jerry was the varsity football coach for decades, and just a great community member and certainly a great youth advisory board member. And I just want to give a public thank you to Jerry. Thank you.
Did I miss anybody else? We're adjourned.
And take.
Did they decide to stay, Ruth?
Yes, they're here. John's in the bottom.
Let me know when the people are here.
Ready?
Ready now? Okay. I'm just. So I'd like to call to order.
Your microphone's off. Make sure it's red. Oh, there you go.
Oh, sorry. I would like to call to order the February Operations Committee, please, and get approval of the agenda. Can I have a motion? From Mr. Denisha. Do I have a second? By Mr. Lightfoot, thank you. Can I have an approval of the minutes, please?
Take a vote for the approval of the
Oh,
agenda.
sorry.
That's okay.
I need to take a vote on the approval of the agenda. All in favor?
Aye.
Any opposed? Is carried. And can I have an approval of the minutes, please? Somebody?
So moved.
By Mr. Lightfoot. Do I have a second? By Mr. Denisha. Any discussion? All in favor?
Aye.
Any opposed? All right, thank you. Next, we have a presentation by Barton and LaJudas for the hazard mitigation plan update. And I have Mr. Condino with us, I believe.
Yes, you do. Can you all hear me?
Hi. Yes.
Good evening. I know it's been a long evening for you folks, so we won't take much of your time, but I appreciate the opportunity. With me, I have Johanna Duffy. There she is. And what we'd like to do tonight is give you a little bit of background and what's going to go forward with the update to your hazard mitigation plan. Your original plan actually was done by Barton LaJudas, working with your planning group and emergency services group back. It was back in the early, 2012 to 15 range. It was adopted in 2015, and by statute, these plans need to be updated every 5 years. The county was awarded a pre-disaster mitigation, a PDM grant to update the plan, and we were fortunate enough to be selected to conduct that update. Approval of the adoption will make the county and participating municipalities eligible to apply for future grant mitigation funding, just like you have been with your current plan. What is hazard mitigation? Hazard mitigation is are actions that reduce loss of life, the number of and severity of injuries, property loss and damage to the environment resulting from natural, technological, or man influence hazard events. The hazard mitigation program is managed by New York State Division of Homeland Security, commonly known now as DISHES, and it's administered by FEMA, and focuses on natural hazard events and the pre-disaster mitigation of potential impacts that may result from those natural hazards. What are the benefits to St. Lawrence County? You certainly get an increased understanding of the natural hazards that threaten the county, development of more sustainable and resilient communities, reduced long-term impacts to human health and infrastructure, creation and identification of needs for partnerships and shared use agreements that support planning and mitigation efforts, and eligibility again to apply for FEMA pre-disaster mitigation funding in the future should you need it. Our approach this time around for the update is a bit different, quite a bit different actually than when we originally did the plan in 2013, 14, and 15. Back then, it was common to form working groups. I believe in the county we had 3 different working groups. And while it was ultimately successful, and you had a successful plan, it was a bit cumbersome. And what we've learned doing many of these since that time is a couple of things. We actually learned that direct contact for us with each of the municipalities works best. And one thing we wanted to let you know as legislators tonight, this evening, is that when you're talking to your constituent municipalities, please let them know. And we're gonna be sending out a letter to each of the municipalities outlining this program. But let them know that they will be getting a letter. They will be contacted by us. We'll be working with the committee members And those committee members at this point anyway include Matt Denner, Jason, Heidi, Don Chambers, Ian, Hazen, Johanna, myself, and one of our colleagues, Greta Day. And we certainly would welcome at any given time anybody on the ledge that would like to participate or be included.
All right, so I guess I'll pick up because I think John froze on us a minute. But really, as John was saying, we wanted to make everybody on the legislature aware that we were reaching out to all the municipalities. There will be a mailer that goes out to everybody to have them indicate their participation in the process moving forward. And as John indicated, we'll be looking to put a lot of meetings together moving forward with each municipality separately so that we can work with them through this process and through the various steps. So as you look to meet with your constituents, as John mentioned, we welcome you to make contact with them, let them know that we're looking to engage in this process and move forward, and they'll be hearing from us in the future. And there'll also be a couple public meetings as well that will occur. So that's it. We just wanted to provide a summary of the process moving forward.
Thank you very much. Does anyone have any questions for them? Mr. Denisha?
Not a question, but a comment. When we did this the first time around, I was a town supervisor. And I know the St. Lawrence County Planning Board, Heidi specifically, worked with a number of towns. But the whole process is something that was new to the towns. And it was quite an intimidating process. So I hope this time around, I know all the towns, the towns that I'm familiar with are aware that the hazard mitigation things come around again. And some of the supervisors are new, some of them are veterans. But I think it's a good project. And I guess that's the thing that I would ask is to keep in mind that it is intimidating, especially if you're new to the process.
Right, certainly. No, that's a very good point, and that's really why we wanted to meet with you and let us know what process we're looking to undertake so that we can have your support moving forward, and trying to make those connections as well with people. Certainly, we have a little bit more work cut out for us given the current climate and having to do a lot of things virtually and maybe limiting some of that person-to-person contact that we would look to have otherwise. But as I mentioned, we will have a mailer that goes out to all the municipalities, the elected officials in each jurisdiction, and we'll look to play off of that with some outreach shortly thereafter.
Yes, thank you. Thank you. Mrs. Hager?
Thank you, Madam Chairwoman. Ms. Duffy, are you going to, I'm assuming, and correct me if I'm wrong, these are going to be probably Zoom meetings when you start out? And if so, are you going to send us a link, or how would we participate just if we wanted to find out more about it?
No, that's a great question. We do anticipate having to likely meet virtually for a large portion of the duration of our contract, hopefully with either pairs of municipalities. Sometimes we'll work with villages and towns at the same time, or towns. Really, it's going to be up to them. We do have a team of folks working on the process out of our Watertown office, so they're very close geographically, and they do have the capability to very quickly, go up and meet with people. Any time that we're holding a virtual meeting for any legislator that might be interested, we can certainly provide that Zoom link. If people are interested and would like to attend, either with every municipality under your guidance or certain ones, but we can definitely try to put a summary together and make that accessible to this group, so you have those opportunities.
Thank you very much.
Thank you.
Any other questions? Seeing none, thank you very much, Joanna, and please tell John I said sorry I didn't get to say goodbye to him.
Right. Thank you all very much. Have a great night.
Ready for the presentation of resolutions? Everybody okay? So I have a resolution, is the sheriff? I see the sheriff, okay. A resolution modifying the 2021 budget for the sheriff's office and forfeiture reimbursement from a county surplus auction. Sorry, I move that resolution. Mr. Denisha, are you moving it or seconding it? Move. Okay, you're gonna move it. Do I have a second, please? Mr. Lightfoot and Mr. Forsythe. Go ahead, Sheriff.
So good evening, everyone. So this resolution is about the county auction we had recently. We had some surplus vehicles, 2 that were sold, and they were originally obtained from a forfeiture. Under the rules of the Department of Justice, those monies have to go back into my equitable sharing account. So I'm trying to move this resolution.
Does anyone have any questions? All in favor?
Aye.
Any opposed? No, motion passes. Anything else, Sheriff? Oh, wait, Mr. Akers, did you have a question? You had your hand up. No, he was.
Typically just the jail count, I usually share.
No, I was just signaling my approval by a thumbs up.
Okay, thank you, Mr. Akers. Thank you, Sheriff.
And maybe just the jail count. Jail count.
Oh, and I'm sorry, do we have a count of people in jail?
I do. It's 101.
Okay, thank you, Sheriff.
Yeah.
Anything else, Rick? And so for the district attorney's office,
Oh, I believe.
is it Sarah?
Yes.
Okay. Hi, good evening.
Hi, it's Sarah Charpentier. How are you?
Good. So I have a resolution authorizing the chair to sign a federal equitable sharing program agreement annual certification report.
Yeah, it's something that we do every year. We have to file it in the first couple months of the year.
Sorry, I just need to get a quick, so Mr. Denisha, you're gonna move that and a second by Mr. Reagan. Okay, go ahead. Sarah, you can go ahead now, sorry. She's frozen.
It's a report that we file every year. It's an accounting for anything that we've seized in forfeiture for federal prosecution or in our joint efforts with our federal law enforcement partners.
Okay. Do you have any questions? Any question for her? No? All in favor?
Aye.
Any against? Okay. So that passes. Thank you very much.
Thank you.
Thank you. We're good? Okay. Next up, we have planning, Jason Fotenhauer.
Thank you very much. Good evening, all. I'll just share with you 2 quick updates on 2 projects that planning and others are working on. The first is the lead grant that I do report on monthly. We've seen a good bit of activity over the last month or so. We have a number of projects that are moving along. I'll just give you a quick update on some numbers. We have 1 contract that's signed in January, and work is beginning next week on the 15th. Another unit has received bids and will be awarded this week, with work hopefully proceeding shortly thereafter. Another unit has bids that are due tomorrow, and 2 more have bids that will be due next week on February 18th. So that's 5 projects that we hope to be well underway in the next few weeks. So we're excited about that because this is sort of a breakthrough with some activity here. We've also submitted a letter to HUD. That's a letter that has been co-sponsored by a number of different agencies in HUD's Region 2, which includes New York and New Jersey. So we're a part of that, part of Region 2, and it's basically a request to HUD to take a look at the cost cap that they have in place and see if there's any flexibility with moving that cost cap up a bit, just because of the the costs that are really tough to deal with, certainly in St. Lawrence County, and from what we hear from our colleagues around Region 2 in other parts of the country as well, that what HUD has for a cost cap is just not realistic. So that's something that has been submitted now, and we're hopeful for some response. We received a letter last week from HUD that has to do with the formal performance scoring assessments. HUD is very metrics oriented in terms of production. So we have been sort of on a stay. Well, we have been on a stay for the last 3 quarters, and they are looking to extend that stay until the end of the second quarter, so the end of June of 2021. That doesn't mean that they're not looking at our performance at all. It's just they're not holding us to our original benchmarks that we had in our original application, which is a good thing because, of course, we have with COVID and other challenges, we haven't been able to meet those original benchmarks. But we do intend to renegotiate those benchmarks once the stay is up. All that to say that the grant we're making progress. It's not where we would ideally want it to be, but I think we are moving forward. Of course, we need to continue to have leverage money. The reason we're going to be able to do some of the projects that we can do, even with a little bit of movement on the upper cap limit, is because we have money from another program that we're leveraging with the HUD money. That money will only go so far. So we do have another funding round that we're anticipating opening up soon through the state, and we're looking at what application we actually want to write for that. If we want to write, we usually sort of go back and forth with our housing applications. One year we'll write a housing rehabilitation grant. The next year we'll write a first-time homebuyer grant application. So this year would typically be the first-time homebuyer's turn, but because of this lead grant, we may pivot and look to write a housing rehabilitation grant, so we can take that money, leverage it with the HUD money, and make the projects work. That's still in negotiation stage because the funding, the release of funds has not been issued yet by the state. So we'll see what that looks like once we actually get a notice of funding. That's all I have on the lead grant. Happy to answer any questions if there are any.
Seeing none, broadband survey efforts.
Okay, thank you. Yeah, this is something that I know was near and dear to a lot of hearts when it was initially discussed back in December. We've again, as you know, partnered with the Development Authority of the North Country, with DANC, and we've been meeting on a weekly basis with DANC and with the consultant ECC Technologies. So the team from the county includes Rick Johnson from IT and myself, and there are several representatives from DANC, and then a slew of people from ECC. 4 or 5 are usually on the call when we meet. They are rolling out the assessment, the broadband assessment, which is what they've been tasked to do, what the consultant has been tasked to do, and what we're working on. And that assessment has 2 prongs. The first is the actual physical assessment of the pole infrastructure that exists in the county. What is entailed with that is physically driving around the county and looking at towers and poles and saying, okay, yes, we've got high-speed internet here, we don't have it here. So that effort began last week. And we always have our updates on Tuesday morning. So I expect tomorrow morning we'll get a bit of an update on how that progressed throughout the week. The second component is the survey component. And this survey has come together, and it'll be similar to what we've seen in, or what has been initiated in Lewis County and what is just rolling out in Jefferson County now. And it has two components within the survey. The first is a speed test So this is interesting. So the survey is something that, you know, the irony here is we're doing a survey on the internet or about the internet and how good your connectivity is. But if you don't have any internet, you don't have good connectivity. And how do you respond to that survey? So how it was presented to me was that, yes, that's a good point, and we'll address that, and I'll address that in just a minute. But one of the real benefits of having an online survey here is the fact that we can actually pinpoint how good or poor our connectivity is, our broadband is, and you do that through a speed test. So someone will go to the survey. There'll be two phases. There'll be do the speed test, and I'll show you an image of it in just a second if time permits. But you can go and do a speed test to determine how robust your internet is at your physical location. Part of the survey involves putting in a physical address where you live, and then doing the speed test to determine how good your broadband is at that location. So that's a really important component of it, and it has to happen pretty much via the internet for you to do that speed test, to test your internet connection. The second component is more of what you would consider a traditional survey, and that's also part of the online component. But it has about 30 to 35 questions, depending on which group you fall into. You can either go through as a homeowner or as a business owner, and the questions will sort of cycle out depending on what path you take there. But that is something that survey component is something that other people that don't have internet can certainly fill out if, you know, as they're made aware of it. So if someone doesn't have connectivity, wants to do this survey, they can contact the point of contact in the county will be the planning office, and they can call us up and we can talk them through it. We can take the information over the phone, fill out their survey, and so they'll be accounted for in the review process. Just some more specifics on the rollout of the survey. February 19th is the go live date for that, so that's in the next week. There'll be quite a media blitz that is being put together by the communications director with the Development Authority, someone who has a lot of experience rolling out these types of things. So there'll be a combination of online, email, print, direct mail notifications about the survey and speed tests that will be going out. And I can show you the front page of the survey if that's your preference, if you'd like, or happy to answer any questions from the group on the broadband survey.
We may as well go ahead.
Okay, just bear with me while I share my screen here.
Thank you, Jason.
Can we all see this picture of Singer Castle?
Yes.
Yes.
Okay, so this is the front page of the survey. It's a number of different photographs are sprinkled throughout it, and I won't go through the whole thing because it is lengthy. But this is just the front page. You've got just the home button here. Frequently asked questions. If someone has some questions, why are you doing this? How is this necessary? Why do I have to put in my address? That sort of thing. The contact screen here will bring us to where you can put in information, more questions about it if the FAQ doesn't answer your questions, and that will go to us, and we'll get information from DANC or the consultant as need be. And then a little bit of an introduction here about what it is, why we want you to take it, how you can take it, and then the speed test, start survey and speed test, or if you don't want to do the speed test, just start the survey. And I won't start this one, but I will start the survey only here. it goes through, again, some more pictures, a little more information. Click here to continue. And then this is where you put in your address, and then home or business, nonprofit, government, other, and then next. It'll continue on for about 35 questions, as I said, again, depending on how you go through it. So that's pretty much where we're at now for that. Happy to answer any other questions with regard to the broadband survey.
Mr. Reagan.
Jason, a lot of people in St. Lawrence County own additional properties, and I often hear from them where they have spent a great deal of money winterizing what had been a vacation home and turning it into a permanent home, only for them to discover that the cost of bringing broadband to that location costs as much as it did to winterize the house. By the way that the current survey is set up and saying homeowner, I think it should say property owner, so that we get an idea of these additional properties that, just as they need electricity and need phone service, also need broadband access, because we're seeing more and more people moving into St. Lawrence County and bringing their jobs with them, but they need access to broadband, and some of them sadly don't find out that there isn't broadband at the property that they're buying until after they've bought it, and then discover that it's going to cost them $30,000, $40,000 or more to bring broadband to them, and that creates problems. So I would appreciate it if you would take that up with the committee, because I think that, in the rural areas where we're talking about, they need access to broadband, and St. Lawrence County needs to be able to help bring these people into St. Lawrence County and bring their jobs with them, and in many cases bring new businesses into St. Lawrence County. And it's critical to do that by providing broadband service, and this survey gives us an opportunity to help identify areas where it doesn't exist.
Thank you, Mr. Reagan. Anyone else? Seeing none, you do that?
Yeah, just a comment, I know you touched on it, we've spoken about this before, as recently as a couple of nights ago. And it seems ironic to me that we're conducting a survey to find out who has broadband and who doesn't. And the survey is being conducted via
the internet,
computer.
Yeah.
It seems like it's more, it's not, it seems like it's geared more toward not you have it or don't have it, but how fast is it? What's it capable of doing? And in my mind, especially with the remote learning that we've experienced with the COVID, I have a lot of families in the areas that I represent don't have anything So there's, you know, even if it's slow, they'd like to have something that's slow. They would like to be able to connect. So I guess that's the one concern I got, is that hopefully this isn't just about the speed and the connectivity as it is getting, finding out who really truly doesn't have access to it and getting it to them.
If it's okay, Madam Chairman, may I respond to that question?
Yes, go ahead.
Larry, I think that's a great question. I know when you brought it up the other night at the Ag Board meeting, it did resonate with me, and I've been giving it some thought. And I think that the second, or the first part that I mentioned, the first prong of attack here, I guess, if you will, where the consultant is going out and doing that actual physical investigation of what poles have the capacity to carry internet, is going to help us answer some of those questions. It's not the only thing that's going to work here, but I think that's going to help us answer and or identify in the county where there is, you know, absolutely nothing, where there's just nothing on the poles. There's nothing that is going to be of use to property owners in that area. Pardon me, in that area for broadband. So you're absolutely right. We can't just say, okay, it's fast or slow. That we need to dig a little deeper than that. And I think that we can get that out of the first component of the assessment. But I'll definitely bring that up again with the consultant tomorrow when we meet. How it's important to, you know, go beyond just how good your internet is where is it and where isn't it.
Thank you.
You're welcome.
Any other questions? Seeing none, thank you, Jason, very much.
You're welcome. Thank you. Have a good night.
I have a resolution recognizing the month of February as Black History Month in St. Lawrence County. Thank you, Mr. Nation moves it. Do I have a second? Mr. Reagan. It was brought to me when I was looking at the topic that we had a builder that was sort of famous in our area. Mr. Isaac Johnson, he was born around 1844, was a slave, escaped to come north, was a builder here, went back and fought with the Union soldiers to liberate the South, and then returned here to build the town hall in Waddington, Chamberlain Corners Bridge, the famous Catholic Church in Churubusco, and many other things in the St. Lawrence Seaway Valley and in Canada. And I did a little research on it. He had 7 children, and we looked a little bit on Ancestry.com to see if we could find anybody that he was related to that might be in the area or in the state, and we couldn't find anybody. That he died in 1905. But I thought it very notable that he had done so much starting under those circumstances, and wanted to recognize the history of that. Anybody have any? Mr. Reagan?
Mr. Chairman, I just want to thank you for bringing this up and recognizing Isaac Johnson. Isaac Johnson, in his later years, lived in my district, a short distance from my home on New York Avenue. You know, he played an important role in building some of the buildings at the St. Lawrence Psychiatric Center, and was a very well-respected builder for many years after the Civil War, when he come back and chosen to live here in St. Lawrence County, first in Waddington and later in Ogdensburg. And I just, as a side note, we tend to forget that in the 1750s, before there was the United States, when what's now Ogdensburg was a French settlement, the Abbé Francois Fouquet announced to the 13 colonies that any slave that escaped from the 13 colonies where slavery was legal, and who fled to what's now Ogdensburg, would be welcomed to that community. And I think that's a part of our history that we often forget. Thank you.
Thank you, Mr. Reagan. Anyone else? Mrs. Haggard.
Oh, thank you, Madam Chair. I would be honored if you wouldn't mind adding me as a co-sponsor of this. I think this is a great resolution. I really appreciate the research you did, and if it is not infringing on what you've done, I'd love to be added. So thank you.
Okay. Thank you. Mr. Janisha, you would like to be added as well?
I would very much.
And Mr. Janisha, anyone else want to be added to this? Mr. Reagan? Okay. Thank you very much for everyone for your time. Oh, we have to vote, right?
Yes.
Sorry. All in favor?
Aye.
Any opposed? Thank you very much, everyone. On to the Vacancy Review Committee. For the District Attorney's Office.
Yep, Sarah, I believe, is still with us.
She's here somewhere.
She's the new chief ADA.
I know that, but
Is she still on?
Is she still on? Because I don't see her. Do you want me to just?
You don't see her? Okay, I can speak to her.
Ruth will read it. Thank you, Ruth.
So the Vacancy Review Committee balance of consideration this month is on this agenda. The first one is for the Assistant District Attorney. That is the backfill for the replacement of the Chief Assistant that was approved last month. This will provide the opportunity to return the District Attorney to full staff. So the Vacancy Review Committee was in support of this this vacancy.
Okay, thank you.
And then the other is the Sheriff, who I do believe is still with us.
Sheriff, do you want to go ahead?
Sure. The first vacancy is a road patrol deputy sheriff position. I had a recent resignation of an officer. I can tell you that I've got one officer on long-term illness, and 3 presently out on COVID issues related to quarantine. And I have a subject that possibly would want to transfer to our office for this position, which would obviously save us a lot of money in academy and training. So I'm looking to fill this position.
Questions for the Sheriff on the deputy? Okay, keep going.
Okay. And then there's a Phil Corrections Officer.
That's correct. Through the New York State Commission of Corrections, I have to have 56 COs hired at the facility. It's mandated. I had a recent resignation also at that location, and that would bring me to 55. So I'm looking to fulfill the minimum staffing and fill this CO position. So I'll have 56.
Any questions? Seeing none, part-time officers discussion.
Brooks, this came out of the Vacancy Review Committee discussion. And my hope was that if you wouldn't mind, on the deputy side, road patrol, giving, I think you spoke to it a little bit in the vacancy you're asking to fill, but also about the potential for a part-time role.
Yeah, obviously with the COVID issues going on, we're pretty shorthanded in many respects. I know we had a discussion, Ruth and Rita in the committee, about looking at adding a part-time position. They're pretty easy to fill, and we have a union agreement that there's a certain percentage of part-timers can be associated with full-timers, and we can obviously actually add on another part-timer and not violate any union problems. So I'm looking somewhere in the future to look to add a part-time position, just because the workload is pretty intense right now with COVID and some of the people I have off on long-term illness and some other issues that are arising in our office.
So no action, just wanted to have that
Does
discussion.
anyone have any questions for Brooks about that?
Okay.
Seeing none. Okay. The county administrators report.
Okay, so I will skip over a few of the COVID updates. Dana provided the number. Just wanted to mention though, thanks to all of our partners included on the efforts, both at SUNY Potsdam as well as the recently increased efforts at the county location that, as Dana mentioned, has been at the correctional facility. The sheriff has been a great host. St. Lawrence University, certainly a smaller scale than we're seeing at Maxey, but a well-run team effort. So very thankful to everyone involved. If I were to mention one, I'd miss another. So we do have partnerships like the IDA who's sharing staff with us, and just enough resources, I think, out there figuring out where to place them. We are so fortunate to have folks so interested in making sure that when we have vaccine available, that we're getting it out there. And they're willing to do just about anything that we need them to do. Inclement weather hasn't, made folks less likely to come. And certainly public health, yet again, is picking up this effort as they do with everything and continuing on and making it happen. So grateful. Office for the Aging also was helpful with the surprise 65 plus 100 doses in shepherding folks into the building and out of the building, which seeing familiar faces for some folks makes it much easier for them to get in and back out to their vehicles and things. It's just really gone well. So I'm so proud of everybody involved with the effort. And certainly folks who've been through, I think it's a shared understanding between the sites. And we hope this coming week, as we move into Ogdensburg to the Dome, a similar setup again with a big wide open area, that we have a similar experience. So certainly your staff's working hard for you to get that vaccine out there and make sure that everyone who's eligible that we have vaccine for can see that vaccine as soon as possible. I did initiate today a survey. We are 6 months in, my apologies, to our modifications when we returned to work. I think I mentioned this to you. We've put that out there for employees to share feedback with us, as well as provide us with some suggestions. So we'll leave that out there for staff to complete over the next couple of weeks, take in their feedback while the folks, Dale and Dylan, did a great job for us in August, getting all of the modifications out there. So we'll take a look at how well they're working and if we need to make additional modifications going forward. I have 2 transfer of funds to report to you. For the probation department, I have a transfer of $916. This was to cover the cost of an increase in settling out the Governor lease at the end of last year, making that retro rent payment. And then the second transfer is in the solid waste department for the amount of $5,000. And this was a transfer for rent and repair and maintenance, not rent, from the Ogdensburg unit of the solid waste budget over to the transfer stations. So they found they needed some more, basically working through their equipment repair budget quicker than they anticipated. Wanted to give you a brief update. 4 items today. NYSAC is conducting their legislative conference virtually. If you recall, they also did that in the fall for the first time. Still trying to get that information out there, I think, and trying to make sure that voices are heard and carried forward to Albany. For the second year in a row, I'm the chairman of the Taxation and Finance Standing Committee for NYSAC. And they took up 4 resolutions today in our committee meeting. Briefly, it was resolutions to reduce the across-the-board state funding cuts. The second was to end the diversion of sales tax. This was dealing with the Hospital Distressed Fund. The third was to permanently extend all existing local sales tax rates. And the fourth was to support the governor's proposal to extend options to invest cash similar to New York City. Counties are restricted, and this would provide some more latitude in that vein. So all 4 of those resolutions passed. The other standing committees took place today and will continue tomorrow. I'll attend as a member of the Intergovernmental Relations Committee and resolutions that they'll be taking up tomorrow afternoon. The resolution should be, as you'll recall, going to NYSAC on Wednesday. All the committees will have met and resolutions will be put forward for adoption. And after that, we'll share those with you. And if there's any you're interested in bringing forward, we certainly can prepare those for an upcoming agenda. Also, so that you're aware, I am working on the 2021 legislative agenda and will be scheduling a work session soon. We have a couple of items already looking to include, but we certainly will take some of these and frame those also for consideration. The town and village of Canton reached out to have a tour of the Human Services Center. If you recall, or those of you who may not be aware, the Human Services Center facility will transfer at the conclusion of the bonds being paid off in 2032 to the village. And so they, and the county and the town and the village had some conversations a few years back, you may recall, about some potential co-location opportunities. I think at that time they commissioned a municipal building study that they now are looking at the results of and considering all of their options. So this coming Wednesday, we'll meet following the business day in a COVID-friendly way and take a tour of that building. I'll bring you back any interest that happens as a result of that tour. Wanted to mention to you from the services meeting, the social services statistics are on Google Drive available to you. I believe this week, this month, they were also emailed over the weekend. But I did just want to mention, and Cindy and I have talked about this, she's taking a look at that data and going to look at revising how it's presented. So she and I are going to work over the next month or two to make sure that the information you're getting is still relevant for the information that you're being asked to consider at services. So she inherited that information and the way it's presented. I think she'd like to tweak that a little bit. Not to say taking away any information, but looking back 20 years may not always be the best measure. So we're going to look at that and look at a draft of what might be relevant. If you have any suggestions, or there are parts of the social services budget or case numbers or information you'd like to see included, send that over to me, and Cindy and I will work on that. And we hope by April to bring you a new report with information. So for next month in March, you'll see the same information provided, and then we'll look at getting you some more relevant information going forward. Also, I just wanted to make sure there was no objection on services agenda. What Cindy indicated, as we've talked about, potentially bringing you a 5 to 10 minute update each month until September, so that she can give you a little bit more of the Family First Prevention Services Act information. I think it was organized tonight at the global view, and then I think the impact on specific areas without having to make a decision would be valuable as we move through her implementation efforts. Wanted to mention that tomorrow afternoon at 3, SUNY Potsdam President Kristen Esterberg and Clarkson President Tony Collins will raise banners in downtown Potsdam in an effort to highlight the ongoing efforts of each of the campuses and their work together to stop the spread, also to emphasize the partnerships in the region. The banners will read, "One community working together to stop the spread." So that's tomorrow afternoon in downtown Potsdam. I did have a request earlier for an update on the total that sits right now in our health insurance reserve, and that total is $750,000. I did want to mention that we will be looking in March to reconvene the Shared Services Initiative. That took a little bit of a hiatus during COVID last year, but we'll be pulling that group back together. And that also might be a good forum, as Barton and Lojudis was talking, and certainly legislators Denisha's concerns about the intimidation factor. I think that may be a good avenue to have some work sessions so that folks understand and can share ideas if they're willing to do so. So I think that might be a good opportunity for us. And lastly, unless there's questions, we have no meeting next week, and finance will take place on the 22nd.
Any questions? I have one quick one. Are we ever going to end up doing any Sunday vaccinations?
I will let you know.
Okay. On the committee reports, Agricultural Farmland Protection Board, Mr. Denisha.
We had a meeting last Thursday, February 4th, at 6 p.m. via Zoom. And we talked about a number of things. I guess two of the most important things, the planning office, some comments on proposed stipulation for the Northside Energy Center in regards to land use. And we also discussed with Patrick Ames and John Greenwood, John, in regards to the Northern New York Agricultural Development Research funding. And what that is funding that's provided by the state to help our young farmers, folks that are interested in getting into the farming industry. I sent a email to Legislator Akers and asked him what he thought because of his farming background, and he has indicated that he would be amenable to introducing a resolution in support of this at the Finance Committee meeting.
Any questions for Legislator Ganesha?
Our next meeting is going to be Thursday, April 1st.
Okay, anybody have any questions? On to the Alternatives to Incarceration Board, Mr. Burke.
There have been no meetings, so there's nothing to report.
Thank you, sir. On to Board of Trustees for Supreme Court Library, Ms. Fiacco.
There's been no meeting, no update.
On to Emergency Services Advisory Board. We met via Zoom and we talked mostly about the fact that it is very difficult to get ambulance service after 5, 6 o'clock at night. There's many calls that go from the initial call to the next people that are doing mutual aid, to the next people, to the next people. And some people are kind of deciding to just throw the person in their car and drive to the hospital because the ambulance isn't coming in a timely manner. They discussed the fact that they believe that the payment of emergency services people to help with the vaccination effort is affecting people's availability. They also did have some discussion about a general lack of volunteerism in the groups of people as compared to what it used to be. And Jonathan Cartu is working on that. He's going to prepare a short presentation if the board is interested in what's going on. In New York State, the hospitals are not allowed to have their own ambulances. Or in some states, hospitals have their own ambulances to do transports and stuff. We have to rely on agencies here. So he's going to put together an informational PowerPoint or whatever, whether the board would like it as a packet that you get to read through and ask questions later, or you'd like a presentation, I guess. Any comments? I guess we'll start as a packet and then later if you want information on it. But it's starting to affect the simple things of like transferring patients. If somebody goes bad in the middle of the night, you're either getting an ambulance from Watertown to come get them, but there's nobody local. So, Environmental Management Council, Legislator Terminelli.
Thank you, Madam Chairwoman. I will be brief because I have like 3 pages of notes. So we last met on January 19th. And like I said, we had 2 of our youth committee members that were on the agenda. Cole Siebels, our chair from Governor, and Andrew Demers from Hubleton, just kind of talking to the EMC about some environmental initiatives and interests that they had that they were hoping to partner with the EMC for. And out of that discussion, Pat Whalen, the chair of our Conservation of Resources Committee, will be partnering with them to work on education and outreach. Kat Bennett, our EMC chair, and the head of the Canton Farmers Market said that when the farmers market continues on in the late spring, summer, that she'd be able to provide an informational outreach booth for them. And then Emily Sheridan, our DEC rep, said that she would be able to connect with some programming and information for education and outreach in St. Lawrence County on how to partner youth in the community with environmental and conservation awareness and issues. So that was the first part of it. Monthly, we typically have a presentation. So this month's presentation was actually by Kat Bennett, our chair, and she owns a small-scale certified organic regenerative-based potato company called Milkweed Tussock Tubers in Oyster. And her family, her parents, actually own Bittersweet Farms. So she kind of presented to us about the regenerative farming versus the large scale corporate, some benefits of it, and asked, the group to raise awareness of the local smaller farmers that we have in the North Country, and that, the time that they spend on there, a lot of them do heritage crops and things like that, and heritage livestock. So the time that they spend, they oftentimes can't dedicate to advertising. So, being aware of who those people are in your community, and Garden Share is a great resource for that. And then, paying homage to them. They do some great, like they have a Workshare Warrior program it's a non-monetary community supported ag program, in which instead of people like a typical CSA, you'd invest money and then you'd get some of the produce or the livestock from it. They actually it's a program for low income community members. So they actually can work, they dedicate hours, and they learn how to farm, how to till how to manage the farm and the crops. And then they take home a share of the harvest once it's all done. So it was a very, very interesting program. And some of the work that they've done to actually bring back some of the species of potatoes, for example, that were kind of indigenous to our area and that we don't see anymore, that you don't see in the grocery store, but that they're grown right here in St. Lawrence County, was pretty amazing, and some of the research that's been done on that. So that was exciting. And then the subcommittees, each of them reported out, the 4 subcommittees reported out on their priorities and what they're working towards in 2021. And if you want specifics on any of those, let me know. Of note, the Watershed Management Committee have a discussion about DEC plans for Fish Creek Wildlife Management Area and Swallow Bluffs. And they're focusing on forestry initiatives this year in those wildlife management plans. And then our next meeting is on the 17th at 6.
Anybody have any questions for Mrs. Giovanelli? Seeing none. Thank you, Nicole.
You bet. Thank you.
Fire Advisory Board, Mr. Janisha.
Fire Advisory Board, I don't have any update since the last update I gave at the last Operations Committee meeting. We do have our next meeting Thursday, February 18th, and I guess I just wanted to bring up what you had mentioned with the emergency. It's the same, fire service is having the same issues, getting volunteers. Yes, many of the volunteers have been there for many years, and to get new folks is really tough to do. It's because one of the biggest reasons is training requirements are so onerous. It takes, yeah.
Yeah, and we lost our long-term, our old fire coordinator today, Frank Minica, passed away this morning.
Yeah.
So that's a generation of people we just don't have that do this anymore. Okay, thank you. Next is Inter-County Legislative Committee. So we have this by Zoom, right? Because we can't go where everybody is, but we had a Zoom meeting where they talked about the state budget, a few questions, and then they talked about the Ravensbeard Wildlife Center, and by Zoom they had like a little owl with a couple of people with the Zoom thing. Basically, the major component of it was the state budget and being concerned about how much of the state budget is going to affect the counties losing part of their budgets. That's all. Any questions? Seeing none. Jury board, Mr. Sheridan.
Madam Chairman, the jury board has not met recently.
Thank you, sir. Planning board, Mr. Fay. You're muted, Mr. Fay.
I am sorry, I realize I was muted. Start off, I'd like to say Jason did a good job reporting on our lead paint grants earlier in the meeting tonight and in the broadband surveys. I'd just like to bring something to our attention to think about that I think about. Every time I go by and watch this Michael's company putting that KV line in between Messina and Marcy, I look back and we go to meetings and we're told that if the solar panel projects generated so much power, we didn't have any control of them in St. Lawrence County. Jason can correct me if I'm wrong. And basically, I'm looking at this and I'm saying, where are these solar panels going? They're going on our prime land. They're taking our electrical power all downstate. And I'm told that, I don't know if this person that told me has got anything to do with it. The KV line they're taking down is a 2-pole system. Right now they're putting up one that's a 1-pole system. Okay, and I'm told why is that? Because later, if they need to take more power out of here, they can put in another pole system. 1-pole system has the 2 lines on them. If anybody's seen them, they're basically almost into Canton now, or some of the work's on the other side of Canton. So basically, when we're looking at these systems, they're taking our solar power. When our governor's asking for green power, we've generated a tremendous amount of green power through our power plants, Messina, and basically, and we're looking at those plants. When I was a young kid, we talked about how much industry was going to bring to the North Country. I think when I was a young kid, Alcoa had about 3,000 employees. After the power came through, General Motors had 1,100 employees. General Motors had about 800, General Motors had 1,100. Reynolds had about 800. Alcoa had about 3,000. I think we've generated all that power down there. Right now, I think Alcoa has got less than 1,000 employees. There's no General Motors. There's no Reynolds. We're now taking, and every project we're looking at for solar projects are on prime farmland. Messina got cheap power out of the Power Authority. Not many other communities in the North Country did. So now we're looking up in a lot of cases as the planning committee member. Maybe I'm pessimistic, but we're giving up one of our greatest natural resources, our prime farmland. And what are we going to have there? Solar panels and goats and sheep. Maybe I'm not being optimistic enough, but I think we got to think about a lot. If the governor is going to say to us as a planning committee, we have no control over after a solar panel project gets so big, I think we got something to worry about. I don't know if Jason wants to correct me or not, but if he wants to.
I don't have anything to add, Danny. I think that's a good assessment.
Okay,
That's not
anybody
good
have any
news.
questions for Mr. Fay or Mr. Bodenhauer? No? Seeing none? Thank you. Oh, Mr. Akers has a question.
Well, not a question, just a comment. Dan's 100% on the money. We're going to need twice as much food here in the next 50 years, and we only have about 25% more arable land. And so we got a real problem is, do you really want to produce your energy by taking away fossil fuels and converting it into inefficient wind and solar in many capacities, and rather than not even thinking about nuclear energy? And you can't blame the farmers here in St. Lawrence County, and it's happening locally. Around my area, we've lost a couple hundred acres of really prime land. And the farmers are in the commodity business producing milk or corn grain or soybeans or something like that. It's a very limited margin. And so they're looking at, they can do these leases and generate $1,100, maybe $1,200 an acre. So you can't blame them, but at the same time, at some point in time, we're going to be losing all this ability to produce food. And I think that the environmentalists need to get off their duff and actually start promoting nuclear. It's very energy dense, it's very efficient. The newer plants are actually modular and they're put together, they're created modularly and then put together. They're much smaller, they're not as expensive compared to the old nuclear plants. And if they really want to be carbon free, they should be pushing nuclear. And until they start pushing nuclear, I can't take them seriously. And our food production is going to suffer because of this policy.
Thank you, Mr. Akers. Anyone else? Go ahead, Aaron. Mr. Schmidt.
Thanks, Kevin, because I've been thinking the same thing. I haven't heard about anybody looking into nuclear power very much as a possibility, but your comments, I think, are right on. It's come a long ways since 30 years ago or 40 years ago, become much more possible, I think. And so I guess my question is anybody in the North Country looking into it as a realistic possibility?
Well, not in, if I may, Mr. Chairman,
Go right ahead.
not in the North Country, but a recent nuclear plant is being put in place in Washington State, of all places. You know, a very progressive state, and they have realized that they needed to do this. And so the plant, I don't know, I can't really comment it expertly, that's for sure. Just another article that I read. The plant is much safer than those in the past. Basically, the energy is generated when they bring the rods out of the liquid solution. So if there's a failure in the plant, the rods drop back into the solution, which ends the nuclear reaction. And that's about all I know. I just know that it's very energy dense and that we're losing, I think, up to 40 acres a day of tillable land here in America. And that's not counting the rainforests that are being eliminated in Brazil, you know, for soybeans and for corn down there. You know, we need to be, if we're going to be truly thinking about the environmental pros and cons, nuclear has got to be part of the solution. Solar is so large, it takes up a lot of acreage. You got 2,000 acres in the Sackets Harbor that's going into solar. Quite a bit of that land was in corn and soybean and forage production. And that's all being lost right there. And that's prime land right there in Sackets Harbor. So we need to be thinking about the whole picture here instead of just looking myopically at one small thing. Like, okay, it's really cool to do this, this fossil fuels are dirty. Solar's clean. Nobody's thinking about what it takes to actually produce these solar panels, the rare earth metals, the exploitation of the environment and labor. So it's a big picture.
Thank you, Mr. Akers. Any old business? Any new business? Going once, twice, seeing none. Can I think we have a need for executive session.
And I'll read it to you. We will have executive session discussing regarding proposed, pending, or current litigation, and to discuss the medical, financial, credit, or employment history of a particular person, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation.
Okay, given that, can I have a motion to go into executive session? Mr. Smithers, and the second? Anybody second? Thank you, Mr. Lightfoot. We are in executive session. We need